Good morning. The May 12th, 2026 meeting of the Arundel County Board of Health is called to order. Please ensure all phones and electronic devices are set to silent. Let me introduce Dr. Tony Gedden, our health officer. Dr. Gedden.
Good morning. Good to see you all again. And as we are doing this slightly different than previous Mays, we presented in April, on April 14th, and today are here to answer some of the questions that you all submitted to us in between these meetings. And so I'm going to jump right into those questions. Thank you for those of you who were able to submit these. Just because some folks replied directly to me, so I know not everyone actually has seen the questions that we were asked. Going to get started with the questions we received. So one of the first questions was around our Health to Go vending machines and how we determine where they are located and what are the metrics that we're using to determine if they're successful, and are we evaluating those metrics on an annual basis. And so the initial determinations around the vending machines are driven by the locations where we're seeing higher levels of overdose. So we actually, when we were initially implementing the machines, looked at the zip codes and the areas that were having higher levels of overdose. And then one of the other really key portions of this is partners, right? You have to have a location to put them in that is open to the public, is willing to support that sort of in and out traffic. If they have questions, to be good partners with us in loading, helping us understand when the machines need to be reloaded, those sorts of things. And so when we started that, that's really how we decided who would get the initial vending machines, and they have been more popular than we anticipated. And so we actually have had more requests for machines that, like, for instance, all of the libraries would like a machine. Right now they're located in specific zip codes, and the 6 zip codes with the highest levels of overdose, with one exception, which is the Pasadena area, at this point all have vending machines in them. So we are continuing to look at additional placements. Our partners with the Department of Social Services will be instituting 2 new machines, one here in Annapolis in their building as well as in Glen Burnie. So we're continuing to grow where those machines are located, but as far as the metrics that we're looking at on a regular basis, we try to make sure we're understanding what people are using out of each of the machines. Different communities require different things. So if you're thinking literally like a vending machine with chips, how many rows of which product do you want based on what people are actually using from each location? And so the behavioral health staff can tell you at our location in Annapolis, in an American Legion, here's what we're seeing, here's the most popular product, this is what we'll put in. And then some things are seasonal. We definitely see more mask and COVID kits being used in cold and flu season. And so we think about how to load those in at specific times of the year and keep that demand, keep the supply matching the demand. So we're watching those metrics, and we evaluate the metrics really on a monthly basis of what's going in and out. There's also QR codes on the machines for people to tell us if something is out. So the public can also tell us, as well as our partners, to say, hey, you're out of this in this machine, or if there's an issue with the machine, or if they want to tell us what else they'd like in the machines. So we've been really happy with the results from the machines. We've had a good response from the public, and I think probably the biggest issue now is how to actually get more of them, right, and maintain the cost of the supplies. The machines themselves are a one-time cost and relatively inexpensive, but making sure that the materials that we're using, many of which are coming via the state and other grants, will continue in those ways. That was one of our questions for what we're looking at, but we continue to track those machines and hope that this is a useful effort for the community. There was a question around mumps, and the increase that we're seeing was primarily in adults. Do we know if those individuals were vaccinated or unvaccinated? So we don't know specifically for the cases that have been in Maryland. The Department of Health has not released that information on those 43 cases to tell us whether or not those individuals are vaccinated. What we know from studies is that typically individuals who are vaccinated are about 80 to 90% protected, meaning if 1 in 10 were to come into contact with the virus, 1 to 2 of those individuals who are vaccinated may actually end up with mumps. But we know that, like with many other vaccines, the severity of the illness, hospitalization, is also lessened by having the vaccines. And so we don't have the specific data from the health department on those exact cases, but we do know how effective the vaccine is from other studies that we've been able to take a look at. We had a couple of questions about school health, so I'm actually going to go back to those slides. Thank you for referencing the actual slide. That always helps. Around what we're doing with the school-based health centers. And so the first question was, what is a student-only model and what are the other models that exist? And so there are ways that you could create a school-based health center that could serve people other than students of that school. You could serve the broader community, you could serve additional families, you could serve the teachers in those schools. But in order to do that, you typically have to have an external exit, an entryway, right? Most schools are not open to the public to just come and go. And in deciding how to really start with a pilot in one school-based health center in partnership with AACPS, we really decided it was best to figure out how to serve the students first, as they are the primary objective in the school-based health centers. But there are models where you could see them doing both, but it usually requires new build, and you're really thinking about that and wanting that, and a much larger clinic also to serve adults and having more fully staffed operation going. So that is the alternative to a student-only model. And then there were also questions about what is the administrative and clinical partners. So there's a few different ways that you can operate a school-based health center. And throughout the state of Maryland, they use these various models for this. One of those ways is that someone could be the administrative support for this. And in that case, it's that you're the primary legal and operational oversight for the program, making sure that it's following all regulations and kids are getting the appropriate services that they need. But you could both be administrative and clinical, or you can parse it out. And so when you say clinical, this means that we would put out an RFP for a primary care practice of some sort in the county to then be the clinical partner providing those services in the county, as opposed to the health department standing up a full-fledged primary care practice, which we don't currently offer within the health department at this time. And so doing it that way also allows for the continuity of care. If you have a primary care practice that's doing it, there's the opportunity to say, do you need a health home? Could we be your primary care practice? Can we serve the whole family? So we think there's some benefits to that model. But we, the school health staff, Karen Siska Creel and Aisha Alston, have done a fantastic job at visiting many other models throughout the state, sitting with their leadership, understanding how does this work and what are the pros and cons of each of those models, particularly as we are only standing up one. It's hard sometimes to get, okay, yeah, we have 8 of these and this is how we operate. What's that cost benefit if you're standing up one and you still have to put in a lot of the infrastructure as opposed to looking at a clinical partner specifically? And so we've landed on looking towards a clinical sponsor, but we would be the administrative sponsor, and we've discussed that with AACPS, and they are on board with us starting this way. And in some counties, they do a bit of both. So it can be also a hybrid model where the health department or the school system is operating and hiring some of those staff directly, and they've put an RFP out for some because they have that many school-based health centers. To our questions. How am I feeling about staffing overall? It's a good question. It is, overall, I think we're in a pretty good place, but there are definitely challenges. And those challenges for us as the health department, we are a little unique in that we're a hybrid organization. Right? We have both state and county employees, merit and contractual. That is a lot of work. It means that every decision we're making on salaries, how to hire, we're always taking into account the fact that employees are offered different benefits, different salary scales. So that is a constant thing that we are working on and trying to figure out what's the right mix, what's the right balance. And so if I had to say that there was something that probably is the most problematic for our staffing, it's that. I think the other issue that we run into, and I don't think this is unique to the health department, but local government and state government salaries are not always up to market. Right? So when we're competing, particularly in the healthcare space, for therapists and nurses and other individuals who may be licensed, I think we definitely have a harder time sometimes hiring in really specific roles because the salary requirements and the way that quite honestly, some industries have even changed, looking at the opportunities for therapists to operate in a telehealth environment, much of which, depending on the payer mix of your population, we can or cannot accommodate. Right? So you still have to come into our office, you have to see people face to face, probably more often than in a lot of other places. And then you can also, many of them have the option to be fully remote. So a lot of those things make our staffing challenging at times. I think we're making some progress in trying to figure out how we can shift things around, right? What's working where, what do we need, and working with the team to really talk about what is our staffing philosophy, what is our budgeting philosophy, how are we trying to invest in staff. I think there are other challenges that come with local and state government, other things that we don't necessarily do, tuition reimbursement, right? Continuing education dollars. When you do have a licensure, you have to keep that up. So these are things that we run into of, hey, does the department have money for me to go to this training? The short answer is sort of, kind of, but that's not a thing that we can offer to everyone, and we can't put it out there equitably. And so then that creates challenges when you have really great staff members who want to go do things that you can't spread out across, the whole department. That creates challenges. But overall, I think we've made some progress in the last few years, particularly in certain areas of salaries and staffing. We've made a concerted effort. So I think we're moving in the right direction, but there's always room for improvement, and there are definitely areas where we have to get creative and think differently and work with the county and our internal leadership to really figure out how to fill some of our holes. I'm going to skip question 6 and go to 7 because I think it's along the same lines, which is school nurses, to understand how we're stand on shoring up this group. And I want to start with there are 2 different groups primarily in school health. There are health assistants, and there are registered nurses and LPNs in that mix. And so for school nurses, as the council knows, over the last few years, we've made a lot of progress in their salaries. We were also able to add retirement benefits as people come in that they can opt into when they start. And over the last several weeks, I've been meeting with school health nurses on Thursday and Friday mornings as they have their cluster meetings, just to drop in and say, hi, how are you? What's top of mind? And in hearing from those groups, I think we've made a lot of progress with the salaries. Right? People seem in a better place with the salaries. They are appreciative of the retirement benefits. I think some of the challenges we face for the nurses specifically, a 10-month employment doesn't always work for everyone, right? There's a specific subset of individuals where a 10-month contract works. And for some of our nurses, they may really love what they do, but given the economic hardships that people are facing, not having a paycheck over the summer is a hardship, right? Many of them have a second job to cover that. And that's not necessarily something we can change given the model that we have and the fact that not all the schools are open, and there are limited summer opportunities based on summer school. And even the school system has, rightfully so, combined some summer programs into one location, so then you don't need as many nurses over the summer. So we have challenges like that I think are top of mind for our nursing staff. The health assistants, however, I think are a group where we will need to continue to look at their salary range. Previously, the school health program was an actual training site to make people certified nursing assistants. So you could come in a layperson, you would get that training, would leave with a certification that you could use in school health and elsewhere. The state of Maryland Board of Nursing changed their requirements to make sure that everyone is a geriatric nursing assistant for their certifications, and they have that. We don't do that level of, if you're thinking about long-term care, right, and a nursing home or those sorts of, we just don't provide that level of training. We do some of it, and we're able to get to pieces of it, but it meant that our training center could no longer be a certified place to do that. So now we are hiring individuals who are certified when they come to us, meaning we're now competing with everybody else for health assistants, right? And that's just been this year. So we're going to take a really close look at the turnover rates for that group, understand what that's meant for us in our hiring practices this year. But there is a really strong recruiting team within school health. And so right now we really only have less than 5 vacancies for full-time positions. We do have some subs that we need to fill, but the turnaround time to fill those are 5 and 6 days because they are recruiting year-round constantly. And we have people who are either in sub positions who want to move into a full-time position or folks who have expressed interest. When you have this, please call us back. And so it really takes us about 5 days to get someone else into the position. But that is really due to the strong recruiting efforts and the work that they do to make sure that that turnaround is possible and we're not leaving students without the appropriate care. So we're continuing to watch our turnover rate this year. It is slightly lower than previous years. We're definitely not as close to where we were in 2023 and 2024, where we saw our highest turnover rate. But this year we're at about a 27% turnover rate for school health, and that has been, it's higher for health assistants than it is for registered nurses. So again, we continue to look at what is that mix and how do we find the right individuals to work within our school health programs. But I think the changes that have been made have definitely helped quite a bit, and there are still areas that we could continue to work. The question about the 5 navigator positions to help with Medicaid cuts. I think we will have the staffing that we need. This is everything in working with the team that they had identified as, hey, we need at least 1 new person at the front desk because we're going to get a lot more walk-ins. We'll need additional navigators. And so we think at this point, this is the staffing complement that's going to help us. Also, given the projections that the state has about almost doubling the number, it's really close to doubling the number of the staff. So we think people will keep about the same workload, which is important. We don't want folks overburdened. And I think that's what happens when you can't fill a vacancy. Somebody else is still doing that work. Make sure that we're not overburdening the staff that we have in what's going to be an already a little more confusing time with a lot more work to do. Right? Figuring out how to verify work requirements, how to see these individuals twice a year. It's going to change their jobs, and so we don't want that change to be accompanied with much higher workload simultaneously. But we think we have what we need there. And then we had questions around commercial kitchens. I'm going to do a little bit on how this works. This is a process, as with everything else, but when folks go and apply for a permit, a building permit, they're told that within 14 days before you open, you need to reach out to the health department because you will need to do plan review, and we do on-site inspections. So this was kind of a 3-part question. Do we do on-site inspections? Yes, we do. They are required. So we'll go out and see things. People can also submit pictures of their business ahead of time. So if there's something that's like that we can identify out of a picture that's in the wrong place or that looks off, we can definitely tell them in advance of that. We also make sure that folks are able to sit down with our team. So if you disagree with a finding or like this didn't work out, the team will sit down with folks and go through the plans, explain what's happening. They will explain why the decisions were made and what regulation is in violation. So that is a process that's available to anyone who's trying to open a business. People can also reach out ahead of time if they have questions. I've had individuals say, hey, I'm opening a restaurant. Is there anybody in your department that I can sit down with? I'd like to understand how this process will work. And they make themselves available to do that. Sometimes we do have to be judicious with our time. There are only 2 plan reviewers for the county. And so at times it may even be Don or Al, who's our director and deputy director. But if people really have questions, they do make time to provide that education as early as they can. And our final question was on any updated data on cannabis use in teens since legalization. And we added, this is a slide from a previous Board of Health that's been updated just so folks can see kind of where we are, the data that we have through March of 2026. So we continue to see slight increases. This slide will give you ages 5 through 20, 21 through 44, and 45 and up. And so we do see the largest group being that 21 to 44. But if we want to get specifically into 15 to 19-year-olds, here's a little breakdown on the total visits per year, as well as what we've seen from a trend line perspective, showing you what's happened since legalization in 2023. And so yes, we are seeing more visits in this population. The other piece of data that we have is self-reported. So the youth risk behavior surveys that happen periodically. What we hear from those surveys is that yes, there is an increased self-reporting of kids saying they've tried it at an earlier age, or that their peers are trying marijuana. And I think some of this is to be anticipated when something is more readily available. So I think with legalization, because you have potentially more marijuana in the community, seeing these increases could be correlated to the fact that there is more of it in the community that kids can get their hands on. But I think this also means that we have to do more work in this space. And so there are several different things happening throughout the health department. Campaigns around cannabis, work with peers in this space, working with the state of Maryland to push some of the campaigns that they are working on, working with local SAD chapters in schools, and working on a new curriculum to actually get community-based organizations to go into our middle schools, elementary schools, and high schools to teach about cannabis. So there's several different things that the health department is doing on this front, as well as the things that we've done previously with our lock bags and continuing to do education to parents so that they understand the risk to their children. But I think this is another really great reason to talk to school health nurses. They know a lot about what kids are taking, when they're taking it, what they're hearing, seeing, and so really understanding how we can work across our department with a lot of the expertise that we have, both in behavioral health and in other areas, to figure out what's the best way. I had a school health nurse say to me, it's great when I do these presentations, but when I get like a high schooler to come do a presentation to middle school students, it's so much more effective than it is when I'm doing that presentation. So thinking about how we can expand things like that and having that peer support. And then, we all recognize that we are too old to write effective messaging or understand the jargon for some of the populations that we're trying to reach. So we've also had campaigns this year, video contest for the children to actually, you create the ad, we'll put it out there, because again, I have not been a teenager in a very long time. I don't want to go back, but I fully appreciate that they are a specific population, and we don't always have all of the answers on the best way to communicate with those groups. And so thinking of new ways to do that, to get young people involved in that communication. Those were all of the questions that we received ahead of time. We really appreciate you taking the time out to send those to us. We hope we've been able to fully answer them for you today. If there's something else related to these questions that we can send you, happy to do so.
Thank you, Dr. Gedden. And again, as Dr. Gedden said, we previously had an extensive presentation from the health department in April, and that is available online if people want to go into more depth to have that. Are there any other? Oh, I see some lights on. Ms. Rodbian.
Thank you. So I actually have just a couple follow-up questions to the, the information that you shared in response today. What is the nature of the cannabis hospitalizations? What, I'm just curious, what ends up, a cannabis user brings them to the hospital? What circumstances is that under?
Yeah, we actually had a presentation from one of the pediatric ER physicians from Luminous come out to talk to our overdose prevention team about what they're seeing and how children are presenting. And so it's a couple different things. In some cases, it's causing a lot of vomiting for people, right, that they really cannot stop. And so then they're going into the ER for that. But I think more often than not, it's just really odd behavior. And the child, especially if it's a child, they're not always saying, this is what I've taken. So the parent is responding to a lethargic child or a child who is presenting really concerning behavioral health and mental health symptoms kind of out of nowhere. And other times it can be things like a slow heart rate. There's a few different ways that it presents, but that's primarily what they're seeing being presented in the ER. And depending on the age of the child and whether or not the child intended to ingest it or not, there are then additional steps that are taken by the hospital staff to reach out But in adults, the same thing, right? If someone has consumed too much and then they are either paranoid or presenting really terrible behaviors because they feel that something is happening, you also see adults presenting with similar symptoms when they're going to the hospital.
Okay, thank you. Can I ask one more? My next question is, and again, I apologize, didn't have this ahead of time, but do you know the current compensation or the current rate for school health assistants?
I don't off the top of my head. I believe it's between $23 and $25, but I'm going to ask Karen Siska Creel to come up because she knows those rates like the back of her hand. So I'll ask Karen to come and share those rates, please.
Hi, Karen Siska Creel. I was just going to send a text message and find out exactly what it is per hour.
We could come back to that or
Okay.
get an email separately if that's easier. I don't know how folks, some folks are very fast on text message. I guess I have one more, if that's all right. In the schools, we have seen pretty striking behavior in the youngest learners that, seem to have correlation to behavioral health. And so I'm curious if that's anything that you've seen in the health department. I will tell you, it's, there does seem to be a correlation. But did you find it?
Yes, I do.
Okay. I can see the look on your face. I got it.
It's 2309.
Okay, thank you. That's very helpful to know. Thanks. We've seen behaviors in the youngest learners, and there definitely is a correlation. There appears to be a correlation, actually. I shouldn't say that because I haven't done that level of analysis, but when we are hearing from different schools about behaviors from pre-K, kindergarten, first grade, so I guess that's like the 4 to 6 contingent, age group, an increase in violent behaviors like punching. A lot of teachers are expressing concern with this, throwing objects in a way that is, there's a whole health side for teachers, but I'm curious if that is on your radar or if that's something that you could look into, because I feel like there's probably a behavioral health component to that. And there does seem to be a correlation with schools in high poverty or higher need young people, but not entirely. So anyway, I was just curious if that's on your radar, if that's something you might be able to partner with the schools to look at.
It is something that's on our radar. We've heard it from school system employees. We've heard it from the health room staff. We've heard it from clinicians and families who are looking for therapists who serve the really young children, because there's not a lot of them, frankly, who serve that population. And so finding help for a child that age can be challenging. We've heard that. What we're able to correlate it to is we started hearing it after the pandemic initially. And a lot of the thought was children had spent a lot of time isolated, and then the socialization, but now we're kind of past that. Your 4-year-olds now would have been born in 2022, right? So what we're seeing now, I don't know that we have a good answer for why we're seeing it, but we have definitely heard it. And we do work closely with the school systems as well as the mental health agency in their work on the consortium and others to try to make sure that we have appropriate behavioral health care for students in schools. The little ones are a bit more of a challenge. Just again, the therapists that serve that age group is something that we have to continue to try to get more people interested in.
Hope that the pandemic is an explanation and that we'll see, a decrease the further we get away from it. But it is definitely concerning for the kids themselves and their classmates. And again, I'm hearing it most dramatically from schools that are higher need, but I don't think there's any school, socioeconomic group that's immune.
Ms. Fiedler.
Thank you, Madam Chair. Thank you for your presentation today.
I want to circle back to the question on cannabis and teen use. A few years ago, I can't remember which Summer Mako conference it was, but I did attend the cannabis session, and something that just has stuck with me from that session, and I brought up in previous Board of Health meetings, is the concern over teen use and the potential impact to trigger underlying mental health conditions. So as we track the teen use, is that something that we're also hoping to track as far as emergency room visits and not just the immediate reaction to the cannabis use, like the upset stomach, but the longer term impacts on teens?
Yeah, I think typically longer term or longitudinal research is something that's done by like the CDC and other entities. It's sometimes difficult for us to connect. This kid went to the hospital for this in 2026, and then in 2028, they're still having some sort of symptoms as a result. We do know that that happens, though. There are children in particular who this will trigger some underlying mental health issue for that child, and then they are in a very different place after the fact. And so making sure that people understand that that is a risk, that is possible, and that not everything won't always just wear off for everyone. And what does that mean? But those sorts of studies, I think, are also tricky because cannabis is still not legal from a federal perspective. And so getting that sort of research from federal entities and those longitudinal studies to actually follow a child or anyone for a number of years to see how something turns out is something we'll have to keep our eyes out for. But I don't know at this point that we have any particular data points that would tell us if you have a behavioral health diagnosis 2 years from now that it was related to cannabis use, or we try to put something together, but I don't think we have that data at this moment. It is something we are keeping a close eye out on and trying to understand what our partners are seeing that work in this space.
Do we have any information on how the teens are obtaining the cannabis? Are they getting it from home from a parent who has purchased it legally, or are they buying it on the black market and just thinking, oh, you smell it everywhere, I can go get it and I'll blend in with everybody?
Yeah, I don't know.
Okay.
Given that teenagers have been accessing marijuana long before it was legalized, I definitely assume that there's still some market for that that's happening. But how much of this is legalized marijuana that has been purchased appropriately by an adult that then a minor is getting their hands on, I don't really have an answer for that. More often than not, we have children reporting, at least from a health room perspective, somebody else gave me something, is the most common I got, or they didn't know what they were taking. Somebody gave me a candy, or I took, something edible, and here we are. But I also think that is a common response from children who have something they're not supposed to have, is someone else gave it to me. So it is a little difficult to understand exactly where it's coming from. But I do wonder if our other partners may have better information on how children are getting it in the hospitals, right? Are they asking that question of where did you get it? I know that they are, but how much children are giving the appropriate answers or the right one to tell us.
Thank you.
Ms. Ledbetter.
Thank you, Madam Chair. This is actually, as it turns out, a little bit of a follow-up from what Ms. Fiedler just asked, but it really triggered when you said earlier, if you really want to know, and it was in relation to the slide that's up right now, if you really want to know what's going on, talk to your school nurses, because they're the front lines, which then leads me to the question of, and to Ms. Fiedler's point about, where are children obtaining these illegal substances if they're underage? And really this goes beyond cannabis. I mean, this could be alcohol. This could be another form of narcotic that really we don't want our children to have their hands on. Is there a process in place for pulling in the parents to make sure the parents are aware of what's going on? And I know this is tricky because depending upon the age, I understand the answer could be very, very different because of privacy. But also, where appropriate, is there a process for notifying law enforcement? To your point, it makes sense that is a very logical answer. Someone else gave it to me and I didn't know. But in those rare circumstances, maybe where the nurse does become aware of something that might have been improper. Is there some sort of partnership or notification process in place so that parents and, if appropriate, law enforcement, so that we can, if, someone does say, oh, there's a guy who stands on the corner of this road and this road every Friday at 5, I can't imagine it's that, that detailed, but that a notification is, some sort of partnership takes place so that we can be shutting down those illegal opportunities.
There are notifications to parents. So if your child visits a health room and they've had to be treated, or you need to come and pick them up, and this is what they have shared, there are notifications to parents. Much like our partners in our hospital systems, our nurses are mandated reporters. And so if you have a 5-year-old, right, for instance, who has taken something that is unsafe and you don't know where they got it, that sort of thing, we are required to do different reporting depending on the situation with the child and their age and what they're able to tell you and what you think is actually happening. So we do work with our partners in those ways, as well as ACPS, right? Anytime we have those sorts of situations, we have to make sure that we're working with them to go follow their protocols as we are working in their buildings, and with the students that they have custody of at that time. One of the suggestions actually from a school health nurse was, how do we give parents tips on what to look out for? There's so many different things that children are consuming, from energy drinks to, nicotine, sublinguals that you can just, so if you don't know what's out there, vapes, right? If you don't know what's out there, then maybe you don't know what to look for. And so how are we helping the parents to understand, here's some of the newer things. If you see this on your child, this isn't a pack of gum, this is what you should understand about what we're seeing and what they're taking. So that's something that we're working on as well, to give parents more information on the front end, as opposed to just always calling to tell you what's happening once your child is in the health room. But those notifications are.
Yeah, I will say, to your point, I remember I learned as a parent from a school different state that we lived in, about that the vapes can look like little flash drives. I remember it became a thing at that particular school, and they sent out a widespread communication, parents, be on the lookout for this. And to be quite honest, had I not been told through that health department, I would have had no idea. Just completely would have not been tuned into that. So that is very helpful. But as far as partnership, like with law enforcement, where appropriate, does that type of notification take place as well, if there were something compelling or?
Yeah, I can't think of a scenario where it's had to be.
I imagine it wouldn't
direct to
happen
law
very often.
enforcement. No, because usually if we're doing much, it's more on the CPS side. And then if law enforcement is involved, I think that's more typically for us, it would be handled by ACPS. If we're in the building, what are their policies and procedures around that? So I can't think of one where law enforcement has had to be called by the health room staff, but I can't tell you that ACPS is not taking those additional steps as situations unfold, because sometimes it turns, we're covering one piece with the health, but they're covering, what did you have on school grounds? Where did you have it? That piece is not the health department.
That's fair. Thank you.
Any other questions? Well, thank you very much, Department of Health. As we now end sitting as the Board of Health, may I have a motion to adjourn?
So moved.
Second, all in favor? Aye. Motion carries. The Anne Arundel County Board of Health is adjourned until October. And now we will move right in to the May 12th, 2026 meeting of the Anne Arundel County Council is called to order. Please ensure all electronic devices remain in silent mode. We will continue with our department budget presentations, and we will begin our presentations with the Department of Health. Welcome, ladies. So glad to see you.
Good morning. My name is Marika Hannum. I'm the analyst in the budget office for the health department, and they're in the budget book. It starts on page 258, and I will now turn it back over to Dr. Gettin.
Thank you very much, Marika. We will jump right in. Just a brief breakdown of the health department's budget. I think this is important because as a department for the county, we have the largest number of grants. So understanding what's funded for us through general funds, core dollars, which are funds from the state, grants, most of which are from the state, many of which are federal pass-throughs, and then also the opioid abatement fund. So this is just a brief breakdown on our budget and where we are, what we're proposing for FY27. For FY27, the amount of grant funding appropriated reflects an improved budgetary management process, allowing for more accurate reporting. And so what you're seeing in this, if you looked previously, and like, oh, the budget is down, this is just a different way of appropriating funds. And in partnership with the budget office, we are doing it this way this year, and we'll continue to keep you all posted. You will be seeing the same appropriations coming from us this year. But just a little bit on what we're looking to support in the department's budget this year. This proposed budget helps to shore up our infrastructure and bolster some of our workforce, some of which we've talked about previously in Board of Health, but making sure that we're enhancing community education outreach to address appropriate disparities and inequities across the county. So what we're looking for in the FY27 proposed operating budget, medical assistance eligibility staff, medical billing positions, expansion of the violence interruption program, expansion of our REACH program, school health expansion, which is new schools, dual smoking cessation. These are settlement revenue dollars that we're able to access specifically for smoking. Bless you. And the mental health agency salary adjustments for the year. We've talked pretty extensively about our medical assistant eligibility staff and the need and the changes that are coming with Medicaid, but just wanted to break down for you all what we're looking at. So there would be 3 full-time eligibility and enrollment specialists, 1 lead to help with that team, because now we will have 2 teams operating fully if this budget is proposed in both Glen Burnie and Annapolis, and so having that additional lead support on hand, as well as an additional office clerk lead to help with the front desk support. So we'll be funding those 5 positions to work on the changes that are coming as a result of HR1. And this is just a reminder of what those changes are. The total proposed budget for this is $267,300 for those positions, and we strongly encourage the council to fund these positions, as we think this is going to make a tremendous difference to those who are trying to keep their Medicaid eligibility in Anne Arundel County. Medical billing staff. In FY26, we were awarded a one-time supplement to have a consultant come out to assess our current billing operations, to make recommendations for what we could do better, what we could be doing differently. And some of the recommendations from that consultant were that we have a more robust billing team. And so right now we have a number of individuals who are working in billing and reporting up to our finance staff, but this institutes an actual billing manager for the Department of Health. And this position will be really important in generating revenue, making sure that we are billing where appropriate and hitting all of the appropriate billing codes. And it also supports an additional medical biller. And as we see our services expand, understanding that we have more complexity, and we want to make sure that the staff that we have are not overworked. And part of the reason we're missing certain things is because they have too many claims that they're working on per individual. The anticipated revenue behind this, and this is all, these are estimates that we've been able to put together, but we think the additional revenue could be closer to $340,000 that would come to the county. Just as a reminder, that money does go back into county coffers. It does not come directly to the health department. So we hope it would offset the funding of these 2 positions at $167,800 to assist with keeping our billing practices up to date and more efficient. Our gun violence intervention program funding. This year, we were fortunate enough to have been awarded a federal earmark to expand gun violence work in North County. And so we're looking specifically at Brooklyn Park to institute a new violence interruption program similar to the one that we have in Eastport and the program that operates in West County. But to go along with that earmark, because the earmark is $1 million across 2 years. So for us, we've looked at it as $500,000 per year. There's additional training, database implementation, and funds that are needed to get the program off of the ground. And so for North County, we're looking at that funding. It is one time for $245,100 to go along with the $500,000 with the earmark. And then for our West County location, there was $90,000 as a part of their budget last year from a grant fund. This year, that funding will not exist, and so this would be coming from general funds to continue to stabilize the West County Man Up program. But overall, looking for $335,100 to continue to expand and support our gun violence intervention programming work. I believe for this proposed budget, only that $90,000 is recurring, and the rest of it is one-time funding. So we'll continue to work with the council in the future for additional funds if needed to support these programs ongoing. REACH program managers. REACH is a program that's existed in the health department for probably close to 30 years. It stands for Residents Access to a Coalition of Health, and this program operates with healthcare providers who agree to see patients who are enrolled in the REACH program for a set cost. And this allows for individuals who are uninsured or uninsurable to access primary care as well as specialty care. We know that we are going to see individuals, more individuals in need of healthcare access because they will be losing their coverage via Medicaid or will no longer be eligible for Medicaid starting in October for some immigrant groups. And so these two positions are case managers that would work within the health department. This will allow us to serve up to 1,000 new members, and it allows us to do the case management to make sure that people are going to their appointments, that we're helping them navigate the healthcare system, and in partnership with those healthcare providers who are agreeing to see REACH clients. Again, this has been a longstanding program that existed before the Affordable Care Act, changed slightly over time because we saw differences and more folks were able to access healthcare insurance. And so we know what to do as people are starting to, we'll start to see less access to Medicaid. And we hope that the addition of these two positions for $124,300 will help us to support these efforts and keeping people enrolled in some level of healthcare, even if it is not with insurance. New school health positions. So we are looking at an additional 7 FTEs for health room staff. This is all to support changes in AACPS school structure. So there are 2 new preschool programs opening up that will need staff. AACPS right now is discontinuing the use of a shared facility between 2 existing schools. This requires us to then have 2 separate health facilities for those students, and then New Village Academy will be opening this fall. These are mandated services that we are required to provide. So for $439,600, we will be supporting these 7 FTEs for health room staff across AACPS. And then JUUL funding. Much like with other settlements, we're able to access funds specifically around smoking cessation and vaping. And so a number of the things that we've been able to do, contests we've been able to hold, communication campaigns, PSAs around these efforts are funded by JUUL. So the X program, which used to be Truth Initiative, is something that we will be working with this year and focusing on those SAD chapters with 10 mini grants to those youth-led organizations to talk about anti-tobacco activities and specifically around vaping. This funding can only be used for smoking cessation activities, and the proposed budget is $404,800, and that would come specifically out of that settlement. I think that's it. Marika, do we want to move to capital? These are no strangers to you all. Our capital budget requests are one for our septic system enhancements at $3 million, and this is consistent with the current approved program. The failed sewage and private well fund at $80,000, and the demo building code, again, at $150,000, and these are all consistent with the current approved programs in the county. That's it for me.
All right. Are there any questions? Mr. Smith?
I appreciate the detailed brief. I couldn't help notice, though, that almost $8 million decrement from last year's budget. What impact, I mean, I know the FTEs that you have, the positions, 85 is not changing, but the contractual services specifically that's impacted by that, it looks like some of that's disease prevention, things like that. I mean, that's a big chunk.
Well, I'll actually let Marika answer this one because it's more around the way that appropriations are happening with the grants than an actual decrease in the budget.
Check, okay.
Right, good morning. My name is Marika Hannum from the Budget Office. So the way we do budgeting for grants is that we put them in the proposed budget at a level that we think the grant will be appropriated. What we've done this year, because we can't decrease appropriations, we've actually suggested that agencies put it in at 75% of what their typical appropriation, their last award was. And this then enables us, once we actually get the official award, because when we're putting together the proposed budget, we don't have the official awards yet. It's still too early. Once we get the official awards, that's when a certification is done that the funding is available. So at that time, then we square up, what the actual appropriation is in the budget with the actual award amount. And we can increase it, but we can't decrease it. So by going with the 75% of what the last award was as a planning factor, and then when we get the official award, truing that up and increasing it, if the actual award is higher than what we had in the proposed budget, we can go ahead and do it at that time once we can certify the funds are available.
And this is the first time this methodology has been applied from
Yes,
the budget? Okay,
Yes.
all right, thank you.
As a follow-up to that, did we have incidents where we did calculate, we did put in the 100% and then we didn't receive as much? Was that an issue that was coming up?
I'm not sure. I don't know if we've done that analysis to look at that. It's sort of an extra safeguard to make sure. We do have, safeguards in place where finance certifies the funds, so it shouldn't happen that we have an issue, but, just to be on the safe side, especially with the uncertainty regarding federal funding and everything else, we just thought it was a more prudent way to start budgeting for grants.
No, I mean, that sounds, let's err on the side of caution when we're moving forward. So I see that. All right. Are there any other questions? We just got kind of a double dose from y'all with Board of Health and everything. So that's a lot of information. Appreciate that. But let me add one thing as I'm thinking about it. So we have 3.3 million in for septic system enhancements. The recent moratorium for the northern part of the county, one of the things included was that it would not impact people that are trying to switch from septic onto the county system. That wouldn't be impacted. Have y'all seen any type of increase or things in that over the past few months, request for septic conversions or anything like that?
Don thought he.
I was going to say Naomi McAllister, Office of Budget. I have not seen anything yet. I don't know if Don Curtian is here.
Yeah, he's here. I was going to call him up. He thought he was going to get out of this one without coming up.
Hi, Don Curtian, Director of Environmental Health. We have not seen any applications to connect to sewer from septics in that area. I will say this particular wet season, we got 2 PERC applications to evaluate properties in the Linthicum area that can't connect to the sewer. One of them we tested and all the PERCs failed, so it will not move forward. The other one was for a data center and it did not do any testing at all. So for this year, none of that will happen. But for this this is the BRF grant that we get from MDE. We will continue to put nitrogen reducing units in and connect any properties to sewer that want to convert from septic where the sewer line already exists.
Okay, great. Thank you. All right. Well, seeing no other questions, thank you all so much. We appreciate you all.
Thank you.
All right. Next up is the mighty team from Aging and Disabilities. Aging and Disabilities? Yeah. I know. Look at them. Look at them, all decked out. They're all out in full uniform, looking sharp. The nurse people should come in. All right, Ms. Kelly, go ahead.
Good morning, my name is Marika Hannum from the Budget Office, and the presentation of the Department of Aging and Disabilities budget is on page 236, and now I'll turn it over to Carissa.
Hey, good morning, Madam Chair, Vice Chair, and honored members of the council. For the record, my name is Carissa Kelly, Director of Aging and Disabilities for the county. With me today is Joelle Ridgway, my Deputy Director, and Wendy Carasquillo, my Fiscal Manager. So thank you for your time today, as well as your continued support and investment in the Department of Aging and Disabilities. As you know, we serve older adults, individuals with disabilities, caregivers, now veterans, and anyone interested in planning for their future. Our departmental motto is making life better, and in the 2025-2026 service year, we know that we made an impact in over 18,000 residents' lives. The past year, we provided 572,000 units of service to the residents of Anne Arundel County, providing services through 25 public-facing programs in 23 locations throughout the county. We remain grateful for the 70% of our budget that we receive through the County General Fund. Our federal and state agencies continue to support our services through the Federal Older Americans Act and the Maryland State Department of Aging grants. Know that we work diligently to maximize non-county resources whenever possible to minimize our impact on the general fund. In FY26, the department continued to strive beyond existing services, continuing to expand the depth of our reach into the community. Key FY26 highlighted accomplishments of the department address the critical needs for our population. The department launched its Easy Travel Access program to augment the Office of Transportation options within the county for older adults and people with disabilities, providing door-to-door service throughout the county and 20 miles outside of the county at a reduced cost to participants. This provided a niche service for individuals with mobility challenges where curb-to-curb service was a barrier to community access. We are thankful to this administration and council for several investments in the Senior Activity Center infrastructure. We began renovation and expansion of the Arnold Senior Activity Center, which should be completed by July or August of this year. In addition to this capital project, we were able to make several updates throughout all of the senior centers within network, using both local and grant dollars. In terms of social and community support, we continue to answer our community need for energy assistance and eviction prevention so that older adults and people with disabilities can remain safely in their homes. We did this through utilizing emergency funding from state and federal grant dollars. To address mental wellness in the community, we expanded our dementia care navigation program through increasing opportunities for cognitive health education, outreach, and support for people living with dementia and their caregivers. We did this through state operating dollars. We continue to expand veteran services and outreach both in the community, within senior centers, offering veteran-specific programming at multiple centers, as well as our continued commitment to the Veteran Services Coordination Center. We continue to support food insecurities experienced by older adults and people with disabilities through food pantry offerings at our senior activity centers, having partnerships with the local food bank and other community partners. We provided support during the SNAP pause and federal shutdown, and ongoing nutrition programs offered at 22 congregate sites and home delivered options throughout the county. The access and affordability of food continues to be a significant challenge for the residents we serve, especially the older adult population. We look forward this year to creating a sustainable approach to meeting the nutrition needs for older adults within our county. Our nutrition program currently serves older adults, 30% of which are below the federal poverty level. and who depend on nutrition services for receiving one meal a day, often their only meal. The federal and state dollars that fund meal programs are used in part to pay staff that distribute the meals throughout 22 locations within our county. We look forward to the general fund support allowing for cost increases associated with inflation and a food contract that improves food quality and variety. Specifically to increase meals served, offer different food options to those who need medically tailored meals, which is in alignment with national trends. In terms of the future, the Department of Aging and Disabilities continues to push the mission of the department in every aspect of the community. We continue to eagerly explore new funding mechanisms to expand our services. As you've heard us say many times before, older adults are the fastest growing population in Anne Arundel County and nationally. We are now also preparing for a lifespan of 100 years through Longevity Ready Maryland. In conclusion, I am proud to serve the residents of this county, and I look forward to the work ahead of us. And thank you for your time and consideration today, and I can take any questions at this time.
Mr. Volk.
My first question is, how did you read that so single-spaced like that? I know. You need like a little bit more white space in there.
Don't want to
space
forget
that
anything.
out. I was impressed. Anyway, all right, serious question though. I don't know if you had a chance to see it yesterday, but I was talking to Mr. Auld about the new possibility in Pasadena for a library and the site being a combination senior center library. Can you talk to me a little bit about Pasadena Senior Center, the size of the facility, whether you've sort of outgrown or expanded the space there, and then what conversations you guys have already had with the library about the site and possibly doing a combination there? Just trying to understand where everything is.
Sure, absolutely.
Thank you.
So the Pasadena Senior Activity is situated in Magothy Plaza, and so is the Lakeshore Library at this point. The facility is 12,000 square foot, has approximately 5 classrooms, and in addition has a large multi-purpose space. This is our only senior center that is not a county-owned property that we are paying annual rent and CAM charges on. As far as, I'm a public servant. So in order to give you the most informed answer that's not independent of my own operational need, I would want to gain the support and advocacy of my current Pasadena Senior Center membership, the public at large, as well as 55 and older who haven't come out yet to enjoy our center before giving you an informed answer on that.
Okay, well, I guess my question is, have you guys, meaning you, library, and any other departments, talked about the possibility of working together on a new site in Pasadena that would be a county-owned site?
Sure, absolutely. And the libraries are great partners and community asset with a shared mission and vision as the Department of Aging and Disabilities. And if we look to, our Severn Activity Center, which is a shared community space focusing on more than just older adults and functioning as a senior center, but as a community integrated site at large, had extremely positive results in participation. So
okay, and just with that particular community there in Pasadena, do you see the potential need for more space? Like, would it be helpful for you to have more space in terms of the facility you have now versus something else?
And again, I think if I'm looking at it independently from an operations standpoint, of course.
Okay.
There's limited parking.
That's the answer I want. So
It's in a storefront place. I would be interested in, investigating that at the will of the administration, budget office, the constituents at large.
I get it. Don't get over your skis. And if you want to know the constituents, my Facebook page is very active right now. So you can see
Wonderful.
what they're saying. Yep. All right. Thank you.
Ms. Fiedler.
Thank you, Madam Chair. I'm so excited that you mentioned the Arnold Senior Center. I drive by it almost daily. It is going at a fast pace. It looks wonderful. For my colleagues, it was an original Arnold schoolhouse. The very front of it has a lot of history. I love that location. But I wanted to actually touch on the ADA portion of your bill and bringing county property into compliance.
where are we timeline with all of that? Is everything that is government property up to ADA compliance? Is this an ongoing project? What's the status of that?
Right. So some years ago, we did put that project forth out of our department to evaluate 136 of the most publicly frequented buildings for ADA compliance. That resulted in Gannett Fleming giving us a transition report. And that is actively being looked at by central services as they complete and develop new projects to incorporate ADA within that.
Thank you. I appreciate that. And I just want to thank you all for your assistance on constituent cases involving ADA compliance. It is greatly appreciated.
Ms. Ledbetter.
Thank you, Madam Chair. My question is about the veteran services. If you could use this opportunity to highlight, what are some of the most frequent types of services that you find are being used by members of our community? And are there any areas where you could see opportunities for improvement and any needs in order to do so?
Sure. So there are several entities within the county allowing free choice of provider for veterans. When you help a veteran with a benefit, you assume their power of attorney. So I can only speak to that Veteran Services Coordination Center that are one of many throughout the county. But as far as needs, they typically funnel into two distinct areas. One is the veterans benefit, whether it be 100% VA disability need, or whether it be assistance with veterans insurance through CHAMP VA or an entitlement benefit. And those typically take a very long time in working back and forth with the federal government to make sure that that veteran receives their well-deserved entitlement. And then the other pot is kind of a group effort. So the other pot that we receive phone calls are veterans that need assistance with BG&E, that are housing insecure, that need assistance in transporting them just to the VA hospital for a treatment or assistance with dental. The list kind of is a multitude on that end, and it requires my resource navigators to kind of wrap around my veterans benefit coordinator to kind of help with those services and making sure that veterans are safe and respected in this community.
Thank you.
Any additional questions? Oh, Mr. Smith.
Appreciate that. I was actually going to ask that as well. In 2019, 2020, I was part of the team that helped put that process and mechanism together. So it's one of the bright spots I am fond of. What I did want to make a comment on Severance Center 1, I love the staff over there. They've been extremely helpful with finding ways, creative ways, and programming to help a lot of those seniors over here. Here's the bad part, not with the Severance Center, with the county. I would say that we have done a disservice to the Department of Aging. And I say that because you're right, roughly 17% of the population here in Anne Arundel County is like 65 and older. About 100,000 people in this county right now are 65 and over, and yet in our budget, you guys are less than 1%. I would say 0.5%, like 0.6% of our budget goes to almost 20% of the population that's like 60 and over. And the reality is over the next 15 to 20 years, that number is going to double. And everyone on this dais and will certainly be in that population as well. And oh, okay, well, maybe not Mr. Vogt. He'll be close. He'll be close. He'll be close. He's like, don't age me yet. I did say 15 to 20 years, so you might be there. Yeah, okay. And so I hope we can find a way to right-size the ship when it comes to Department of Aging, because it is a train on the tracks, and that train is a light heading towards us of a bulging population that is completely underserved here in Anne Arundel County with the budget and resources that you do have to service those populations. So I just wanted to make that comment, and hopefully we can do something going forward in the future that can address that gap. So that's it. Thank you.
I think we said in the past that y'all are small but mighty. And I want to compliment any time that I refer a constituent over to aging. Y'all are on it immediately. And we're just so grateful. I mean, it is impressive every time that right away your staff is back and saying, we've gotten them in touch with XYZ, getting all the resources. So we really appreciate the work that you do. So, all right. That will do it. So, thank you, Aging and Disabilities, and now come the police department, and we love how everybody is in full regalia today, coming out and letting us. And Chief, I would wait just a minute. It seems like two of our members scooted out for just a second, so we'll give them a minute to come back before we get started. What are you? You're what? You can be close though. No, you'll be at 55. So you will be. So in 20 years, you will be able to join the senior centers, and you'll be able to get and you can. That's right. And you'll be able to get a discount at Goodwill on Wednesdays for a senior discount day. Oh gosh, at the senior centers. It's kind of, and the classes they offer, there was like a Portuguese class. The senior centers are amazing. We're digressing here, but the senior centers have amazing resources out there. That's right. And they have pool tables, and they have, yoga and all the stuff. There's lots you can do there. It's great. It's great. So yeah, when I saw the Portuguese class, but I was like, they offer everything. So, all right. Hold on. We'll give Ms. Pickard another minute. There she is. All right. Police Department, welcome.
Thank you. Good morning, everyone. I'm Donna Rayner. I'm the budget analyst for police, but I'll turn it over to the police for their department presentation.
Good morning. Thank you for your time and consistent support of our men and women. It's very much appreciated. And we also appreciate your in-depth dive into and consideration of our FY27 budgetary asks. Just briefly, our department remains committed to the 6 pillars of 21st century policing and the 3 C's that we identified early on in my administration here. With me, I have Mr. Henry Farrell, who will present further detail regarding our budget, but again, we're just most appreciative of fulfilling our commitment to fully staff our real-time information center, providing 24/7 operations. You all know that the value of it, and you know that that is a priority for us. So we appreciate, again, your support of this investment over the previous 2 years, and we look forward to its full-time operations. And everyone understands that the benefit of the Real-Time Information Center, it will vastly enhance our officer and community safety while continuing to allow us to reduce and deter crime in Anne Arundel County. As you're well aware, we have hundreds of success stories with bringing criminals to justice and providing some semblance of closure to our community members who've been adversely impacted by criminal behavior. So again, you know the value, you've invested in it, we appreciate it, and we're very grateful that we're able to bring things full circle and staff it 24/7. And I'll turn things over to Henry.
Good morning. For the record, Henry Farrell, Police Department's fiscal manager. I believe Donna stated their budget pages start on page 283. They're roughly 11 pages. I'd like to focus on 2 that we have up on the screen for you, which is page 284 and 85 of your budget book. So the moment you've been waiting for, the explanation of the comparative statement of expenditures. So what you have in front of you is a breakdown in 3 different ways of fund, character, and object. I'd like to focus on both the fund and the object. The budget office is required to give you a look of character or bureau. The charter dictates that. In the case of the police department, which is roughly 90% personal services, we move people around so often that it's not good for education or analysis, really, to look at the bureau-wide numbers and it change from year to year. The best example I can give you is if we have officers resign or retire, and we do have roughly 50 of those each year. They might be a patrol officer. They're going to retire, and we're going to move their position into the training academy, which is in the Admin Services Bureau. The numbers jump around all over the place, so not that helpful. So let's look at the fund first, and I'll focus on the increase, decrease column changes from year to year. So under the general fund, you see almost $13 million increase, and that's attributable roughly $9 million of the countywide pay package, $1 million of 9 new positions, and roughly $2.6 million of contractual services, all of which I'll get to the detail a little bit when we get down into the object level. The next is the FAST fund, or the Forfeit and Asset Seizure Fund, an increase of $610,000, and we will be replacing some special ops equipment with that funding. There is a reduction of $1.8 million in grants, and that's primarily attributable to a reduction of a one-time Arctic technology grant. And then, as you can see, a decrease of a little over $300,000 in the Video Lottery Impact Fund. Down into the object level, under personal services, we talked about the $9 million countywide pay package. There's also roughly $1 million for 9 new positions. And there is that $1 million of 9 new positions slightly offset by some reductions in grant overtime. Under contractual services, there's $2.6 million increase. Roughly 2.2 of that is going to the central garage to pay for vehicle maintenance and replacements. And then this year is a larger than average year for helicopter maintenance, as we'll be reaching 2,000 hours, flight hours, and the FAA requires engine overhaul at that time. So there's a $400,000 increase in contractual services for that item. As you can see in supplies, as well as business and travel, some reductions, as well as a reduction in the capital outlay, which reflects the video lottery terminal equipment replacement reduction. And that is my explanation of $246 million. So surprisingly, very little to talk about in such a large number, the largest in the county.
Very little.
Yeah. So on the next page, which is page 285 in your budget book, just going to brief over the summary of budgeted positions. You can see they're listed 1,039 positions. If you add the 9 exempts, that gets us to 1,048. We will be adding 9, as I've mentioned, at roughly $1 million cost. One is a forensic firearms examiner, a school resource officer, a central records program specialist, and then the last 6 positions are all going into the real-time information center. 3 public safety analysts, 2 officers, and 1 sergeant. And so that ends our operating review. Glad to answer any questions you might have at this time. Otherwise, we can move on to the Capitol.
Thank you. Like I said to Miss Anderson yesterday, you do an excellent job of flying right here, right? You just get through it quickly. I appreciate it. Couple questions for you. The helicopter just triggers for me, takes me back to my first budget. So, I feel like we're all over that again. With the $400,000 in maintenance, that I'm assuming is going to continue extending the life of this helicopter. We're not looking at replacing it anytime soon, right?
This is actually just actually removing the engine from the helicopter and doing a complete overhaul of it,
Okay.
which is required by FAA to be able to fly. Yeah.
Okay, all right.
So yes.
Okay. The $2.2 million for the garage fund, so is that our normal amount that we're doing per year, or is that above normal amount?
So the 2.2 I mentioned was just explaining the increase, the 2.6 that contractual service increased. 2.2 of that is attributable to the garage. When you look to the left of that in the budget column, you see $24.1 million. That's our actual budget for 27. 15 million of that goes to the central garage for vehicle maintenance and eventual replacements.
So what's our normal level of funding for that, and why is the additional contractual services of 2.2 jumping up?
I'm gonna guess that comes from the budget office, and I think maybe Donna will nod her head here that most of it's fuel price related for the future. Yes.
Copy. Okay. Does any of it have to do with changing over vehicles from gas to hybrid or electric?
None in the police department.
Not in police. Okay. You guys are continuing to be gas vehicles.
Yes, sir.
I agree with that. I like it. All right. One additional question about the firearms person. So can you walk me through how we've historically done the firearms forensic examinations and why we're bringing that? Seems like we're bringing it in-house. Why are we doing that?
Yes, sir. So for years, we've been using the Prince George's County firearms facility, and they've been kind enough to let us use that. And in exchange for that, we offer them a second review of all their evidence, which is required for CALEA standards and for evidence in prosecution. And we are now opening our own shop here as part of the capital program, and we'll need a second reviewer who is qualified to do that, and that's what this position is.
Gotcha. Makes good sense. Okay, thank you.
Any other questions on the operating? Mr. Smith?
Just real quick, the red light camera systems, is that a question here or for another?
That would be a perfect question for now.
Okay. What has that started to bring in? Just because I wanted to get clarification, because I've heard a variety of different numbers over the last couple of months, and just figured I'd ask you all since you're right in front of us.
So that's a really short question with a really long answer.
Okay.
We started a contract with a company that had contracted with Montgomery County, and we piggybacked on their contract. Since we started that, Montgomery County ended their relationship with the vendor due to performance issues. And so we are struggling to figure out how to handle that. So right now, purchasing is working on a temporary contract with the current company to continue the services until we put out bid specs for a new one ourselves. So what has it brought in? It's very lagging. I'm thinking we're in the $2 million zone, but our expenses were in that zone too. So sorry, it's really hard to get your hands around.
No,
because
that's
there's no fluidity to it currently. I mean, we have invoices piled up and they have revenue piled up because of the performance issue I talked about earlier with Montgomery County.
Is the goal with that program to make sure we have a net neutral policy where is it essentially paying for itself and we're changing behavior because of the?
Yeah, if I'm not mistaken, Don, and correct me if I'm wrong, I think our revenue and expenses are matching for next year, so neutral would be a good approach.
Also, so if you're the operator of the company, this is good business for you, not necessarily the county. Right, okay.
And additionally, I think we have to clear a certain threshold, so they collect the revenue, and if we don't clear that level, then,
We owe them.
Right, yeah, so it's not the most profitable.
Okay.
Yeah.
Is it are we seeing results, behavior change in areas where we have those speed cameras or red light cameras
Right,
located?
yeah, they often will have to move the cameras for them to be profitable because there is that behavioral response, and then those cameras become less profitable once they're in place.
Okay.
Which is good, safe, you know.
Yeah, definitely want to change the behavior because that should be the ultimate goal. I'm always cautious when we get into these, finding additional revenue stream. If there is net profits, I certainly want that to go back to the police department to continue to aid policing. But I was just curious how it was performing up to this point. So, thank you.
Mr. Volkey.
All right, following up on those questions. So it's a speed camera program, not a red light camera program.
It's
right?
both, sir.
It's both. Okay. And when I recall this being presented to us initially, this was a revenue generator. This was not a neutral program. I do. I remember it as it was going to generate some amount of money in excess of what we were paying. That was how it was initially presented. I could give you the numbers I'm thinking, but I thought it was like 4 or 5 million, and it was going to cost us 2 or 3. We were going to net at 2, something like that.
I believe you're correct.
Thank you.
I
All
think
right.
in the last year's budget, there was far more revenue posted as a budget number
Yes.
than the expense.
Okay. But we have not seen that actual revenue generation. What we have seen is more like a net neutral situation.
It is more net neutral, but as I mentioned, there are performance issues with the company, so it's very hard to get the data.
Understood. And when we entered into this, what level of diligence was done by procurement to find out about any of these issues on the front end versus simply saying, oh, Montgomery County's doing it, let's piggyback on them? What was that process? What did that look like?
I'm not sure I can speak to that in fine detail, but I know that the first thing they do is look for the simplest method. Is any of our surrounding agencies using a vendor that they like and is working? And so that's what they did. And we found Montgomery County was happy with the vendor.
At the time.
They had used them for years prior. And then there was a company buyout that took place, and the new ownership company had people in place they thought could run this program, and they had no idea what they were getting into.
That offers a lot more detail. So thank you. Okay. All right. And in terms of other vendors that exist in the area, are there a lot of operators who do this?
There are multiple, yes, and that's our goal, is to put out our own specs instead of relying on another agency.
Gotcha.
And put out the specifications and see what kind of proposals we get back.
And do we anticipate that once we get a vendor that's not experiencing performance issues, that this will be a revenue generator, or that this will still be a net neutral operation?
I think that remains to be seen until we see the company's proposals, and we're many months away from that, I believe, putting that out for bid.
Do you think that'll be this year?
I think it'll be during fiscal year 27.
Okay.
But I couldn't tell you when. I don't know what the status of that purchasing effort is.
All right. So at this point, if people are running red lights or speeding, are they getting tickets from this operator?
Yes, I am.
Well played. Well played. We'll leave it there.
Oh, that's funny. That's right, right. Mr. Smith.
I'll be quick. I will say it over the last, when we started this conversation, from my perspective, I never wanted us to be like DC. If you go to DC, I feel like they get tens of millions, and it is a revenue, the whole purpose behind it is to generate revenue. I want us to have safe streets, not necessarily generate revenue. So for me, it's the behavior more so than it is us just creating another pathway to tax citizens or get revenue out of citizens. And so that will always, I always believe that was the intent behind this program. And so I hope that's still the case. Otherwise, we can come up with all different types of things to extract wealth out of your pockets. And I don't want us to do that. And so I really just want to change behavior so that schools and roadways are safe. And so appreciate everything you're doing with the program.
Thank you.
All right. Let's move on to capital.
Okay, and we have one page of capital to speak to. We have one project with dollars in the FY27 year or out program years, and that is the new Northern District Police Station, total of $29.3 million. In the 27 area there, request there is $27.3 million for construction, and to the extent that we have other projects going, you see them listed, numbers 1 through 4. We don't really need to talk about them. There's no future dollars program for them unless you have questions. These 4 projects are roughly on schedule and all seems well.
Any further questions? Chief, you haven't had to say much.
I know, it's amazing.
Pretty amazing.
I can say that I know our Northern District officers are very excited about the new facility.
I'm sure. It's kind of, well, and I will put in a plug for the Arctic that we are glad to see that space working out. And for folks who are not aware of the Arctic, go on the website and check it out and see how fabulous it is and what's going on. But also you can sign up your Ring camera to be part of the program to help them when they're fighting crime. So
I could not have said it better. Thank you, ma'am.
there you go. Mr. Volke.
Thank you, Madam Chair. And to piggyback on that, I had an operational question about Arctic. Ms. Fiedler shared with me that she was at a community meeting and an officer, police officer, said something about criminals say that they don't want to come to Anne Arundel County because they've got, what do they call it?
Something to the effect of they got that watch program.
That watch program, right. So it sounds like people who want to do bad things know that we have this, and it may be deterring them from even coming to the county. But from an operational standpoint, what, if any, noticeable impacts are you seeing in terms of crime, what crimes are committed, how they're committed, where they're committed, based on sort of staffing up Arctic, and what do you anticipate with the 24/7 coverage that that's going to continue to do operationally?
So again, I know that we have many success stories, and it's not in one specific area, it's throughout the county.
Yeah.
I know the impact it's had on our officers has been profound because it assists them with obviously getting to the scene and having more intel than they typically would in years past without that resource. Very prudent and wise investment. I missed the last part though. Mr. Volke, remind me what you just asked.
You were telling me it was a prudent, wise investment, or no?
Huh?
I'm kidding. No, operationally, like, what are you seeing in terms of crime stats from that?
Oh,
Like, can you speak to overall crime as a result of Arctic and how those two things interplay?
Absolutely. So when you look at, and you can see this on our website, when you look at our crime data from 2025 and compare it to years past, this was the first year where we were green in every area. That means crime was down in every area of crime that we track and post to the community. The only area that was adversely impacted were our homicides. We were even at 10, and at the last minute, we were notified by Baltimore City that they conducted a thorough homicide investigation, but that it actually occurred in our county. So we assumed that one over from the previous year. But never have I seen in all my years where we're tracking data that we close out a full year in all green. So, I mean, that speaks to the impact, not just of the boots on the ground, the work of our men and women, but also we have this resource that has helped catch the bad guy.
Ask a follow-up? So, and I just read a news article the other day about your 12-hour shifts, right? And that seems, I'll say mixed bag is how I'll describe it. Like, some people like it, some people seem to not like it as much. I guess my question tying into Arctic and the 12-hour shifts is this. Are you seeing that in terms of the officers who are on 12-hour shifts and the fatigue that causes naturally for anybody, is Arctic doing anything to help with the way that they're able to be on the job for that long? Like, is it giving them more information, so it's allowing them to go into situations and maybe stress levels are lower because they're more prepared or they're more informed about what's going on? Like, do you see any interplay with that at all?
Making a direct correlation, just from talking to our officers, they
I'm looking anecdotally.
They absolutely appreciate, the fact that Arctic is able to provide them information that typically in years past, they would not have had that information in advance. In terms of fatigue, I know that, the department conducted a poll, the FOP conducted a poll, and the department was divided 50-50 on this issue. And we asked, we'll come back and, assess, several months in, but it's going to take time. But generally, I've heard positive feedback from the officers I've spoken with about the shift to the 12 hours. And in fact, it's been a bit of a recruitment tool for us because there are officers from other agencies who made those statements, if Anne Arundel should ever go to a 12-hour shift versus the 6 and 3, that they would most certainly apply, and we are seeing that increase.
Okay, got it. Thank you.
But we'll continue to monitor, because overall, we took into consideration the staffing, but also we wanted to make sure that, that our officers were getting adequate rest. So we'll continue to monitor and advise.
Thank you.
Yep, thank you.
Ms. Ledbetter?
Thank you, Madam Chair. This is a question my colleagues in the northern part of the county probably know the answer to, but how old is the current Northern District Police Station? When was that actually built? Approximately, if you don't have it memorized,
I'm guessing 35 years old.
Wow. And when's the
Not
last
really
time
sure.
we, as a county, built a police?
The
I think,
Eastern
is Southern the
District-
newest?
Eastern District was
Eastern
built
was the newest.
maybe 12 years ago.
Okay.
Eight-ish.
It's young.
I'm sorry.
It's still
Yeah, I don't know the
Yeah, I don't
exact
know
number
the-
on that Northern.
Okay. Yeah, thank you. I was just trying to gauge timelines, so appreciate it.
All right, Mr. Smith?
And I'll be quick.
wait.
I was just gonna say, my phone a friend told me 1978 for Northern.
No, that's 48 years. Education.
I believe that might be older than Mr. Volk.
48 years.
1978. So again, the Northern District officers have been very engaged and involved in this process, and they're very excited about, the anticipated delivery of a new facility. Going to be some hiccups, to get there, but it's coming to fruition, and they're very pleased.
Mr.
Say it was
Smith?
10 years older than Mr. Volkey, is that what you said?
That's right, it's 10 years older than Mr. Volkey. That's right.
The attrition, as well as hiring, how is that balancing act? Are we still able to keep the glide path on hiring more than we're losing through retirement, so that our numbers on hand continue to grow? I know we got like 809 plus whatever positions are in this book, but what does that look like going forward?
We still are seeing vacancies, and, we have conversations quite frequently about why potentially in our profession, and we know that over the last many years, policing has not risen to the level, the expectations of some community members in other areas of the country, not necessarily in Arundel County. That's had its adverse impact on hiring. And we've also looked at the fact, and we love our young people, but they're more tactile, more apt to look for work either virtually, whether you work from home, or they create their own streams of income by using applications. I mean, that's the only thing, we can, as professionals, we're constantly having these conversations, but that's one of many things we surmise, is that it just has not been appealing to some of the younger generations. So, we have younger recruiters out there making every attempt to connect with those folks and make it more appealing to join the profession, but all of us are experiencing the challenges.
I just want to make sure what we're doing policy-wise, pay packages, all those things are assisting with it. That's all. Interesting to see if there's any.
We believe it's made an impact, and this is still very much a well-respected organization. We don't see officers leave Anne Arundel to go elsewhere. We do see laterals come from other jurisdictions to Anne Arundel County. So it's just, striking that balance.
So if I could speak to numbers, I don't know if this will help you, Councilman, but we lose about 50 officers each year to retirements or resignations. Last year, or in the current year, 26, we were able to hire 47 officers via either laterals or recruits. So we're losing ground, but really slow, and we're working on the recruitment effort, as the chief said. How many vacancies do we have, boss?
I know last I checked, I think we were at 31, which isn't bad comparatively speaking when we look at, other jurisdictions. But for us, we're used to being at current levels prior to the shift changing regarding policing.
I think without those changes to the salaries, we probably would be in a much deeper hole.
All right, thank you all very much. Appreciate you.
Thank you.
Appreciate you too. Thank you for your time.
All right, next up is Animal Services. Linda probably knows. Yeah. Linda was probably here. She does. She knows it all. Yeah. So. All right. Ms. Roll, can we give like 2 minutes because 2 people jumped up and left, and just so we can all hear from you. So give them a couple of minutes to get back. Ms. Roll, please, go right ahead.
Role with Animal Services, and
Good morning, Bo Zhao, the budget analyst for the Department of Animal Services. Their budget begins on page 277 of the FY27 proposed budget book. I'm going to turn it over to Director Claudia for her presentation.
It's been a very busy year as a new department. Our core mission remains the same, our core work remains the same, but we continue to fine-tune how we do things. Our organizational chart, the basic structure remains the same. This does show the addition of a deputy director. And toward the bottom, the management assistant 1 leads our customer care area, kennel supervisor with animal care, and animal control supervisor as our 3 core areas. I wanted to touch on some good work that we did this year. Our live release rate, some people call it our save rate, reached almost 87%. Maybe I should have put 86.9 on that slide. That is the highest ever for Anne Arundel County. And thank you. And we feel like we can get it higher. So the redemption rate of lost pets going back to their owner, is above the national average, which is awesome. It's actually my favorite thing, even more than adoptions, is a lost pet getting home. That's another area we're looking at some good strategies to get that even higher. So we launched our Paws Around Town program this year, and some shelters call it Dog Day Out. Basically, a member of the public, the sign up is pretty easy. We do get their information, we give them, a lot of information, and they can take a dog out for a few hours. They might go to one of the county parks, they might take the dog to their backyard to play, and then a snooze in their living room. It's been so well received by the public. It's been amazing. It's obviously good for the dogs. We're learning about them. The Paws Around Towners complete a report card when they get back. And they also send us photos that we can add to the animal's bio. It's just, it's one of my favorite things. We also launched new software called Shelter Buddy. It's industry standard. This was by far the biggest project of the year. We use our software from a call comes into dispatch, getting on the computer, all along the way, adding notes, adding medical information, all the way to the outcome of the animal. It's been huge. Obviously, a lot of retraining of everybody, but it's going pretty well. Shelter Buddy also has very comprehensive reporting capabilities, so it's now much easier for us to go in, look at things like length of stay for certain kinds of animals, have a more guided strategy for what we do. Shelter Buddy also enabled online dog licensing. Gone are the days where you must come to the shelter to license your dog. You still can, because we didn't want it to be online only, because that's an accessibility issue. But it's much easier for dog licensing now. We were pretty efficient with our new hires this year, and our turnover remains low, which I'm proud of. Thanks to the Friends of Anne Arundel County Animals, we have an X-ray machine on site. So that has led to more efficient treatment, diagnosis. It's been a game changer. We also have a much higher social media engagement. From 2024 to 2025, our Facebook engagement rate went up 82%. So that's a good thing. Overall, we've gotten some good positive media, everything from Severna Park Voice to the Gazette to the Washington Post. And a few months ago, one of our volunteers was featured on Good Morning America First Look. So we're trying to keep that positive momentum going. I also want to acknowledge the impact of the positions that were added in FY '26. In animal care, increased staffing allowed us to give the animals and our volunteers that want to work with our animals a full shift on Sundays. That wasn't the case before. And it was not, obviously not best practice. The additional veterinary technician, moving from 1 to 2 vet techs, has improved medical care for our population and more efficient spay-neuter surgeries. And the office support specialist that works in the field services area, she is always busy moving along the animal bite cases, and she works hand in hand with the health department. So thank you for that. Animal Services does have one new position request for FY '27. This position was requested in 2026 and is still a crucial need. This would be a management aide and an adoptions coordinator. We do approximately 1,800 adoptions a year, but we don't have a dedicated leader. My first week at the shelter, almost 2 years ago now, I said, so who's in charge of adoptions? And everybody kind of looked at each other. So obviously we're doing a lot of adoptions, a lot of good adoptions, but without some real strategy, you know, how to market animals, there's so much involved. We could also flag certain animals for a more conversational adoption counseling. Some animals, we know they might have more difficulty adjusting to a new home. They might have more specific needs, so we might flag that animal to meet with this coordinator. The coordinator's not going to talk to 1,800 adopters. That's not really possible, but there's a lot we could do. And this would also allow for supportive adoption follow-ups. Maybe some animals are flagged for that follow-up, but just in general, adopters hearing from us, how's it going? Do you need any resources? We do have a management aide right now, and her job, she oversees a very robust foster program, volunteer, and she's in charge of events. She's also taken over our social media. It's an overwhelming scope of work. The new management aide we would pull events away from the existing management aide. So that would allow us to really get back out into the community more. Some people just aren't going to come to the shelter. So having more adoption events, getting our animals out there would be a huge help. So. There is a new capital project, $530 million. This would be the first step to getting a new animal shelter. The funding is requested for initial concept design and site search for a new facility. There was an assessment done, a full assessment done in 2025. It was issued to us in December. Very comprehensive. They looked at the work that we do and how we do it in that building, obviously looked at the integrity of the building itself. The conclusion was that our current building does not meet the current or future needs of animal services. So we are excited about this first step in the process. Do you have any questions?
Yes. Oh, sorry.
Mr. Markey.
Thank you. On your new facility, what are your specific parameters of what you're looking for? Like, how much land do you need?
There were, in the assessment, I don't have a specific answer for you, but in the assessment, there were a few ideas given. We definitely need more land than we have.
How much do you have now?
I don't know. It keeps shrinking.
Well,
I'm not sure. I know.
The reason I'm asking, so I've asked this question to the libraries, and they're looking at a particular property in my district that's
Okay.
about 11 acres, and they're looking at that for a possible library site. And then I also just asked Aging about that, because the idea is maybe put a senior center there. I'm like, I was talking to Councilwoman Pickard, maybe we'll make this a government services hub, and we'll get animals, control there, care and control over there. So, I mean, animal services would be great at that. It's right by a major highway. It's got easy access on and off. So I'm just asking you because I'm curious.
I'll be in touch.
I would love that. I would love that. So I'm just saying this publicly because I'm interested in kind of seeing where this could go.
Okay.
Because I think that entire site being used by multiple government functions could be very helpful. So,
I agree.
all right. And my other question about your management aid. So, yesterday the library was here. They talked about Maryland Corps, which I'm sure you know about, Governor Moore, and kind of trying to get people into positions. Has Animal Services done anything in terms of looking at bringing in people from Maryland Corps to work, and could they do anything to help with the workload? And would that be an option that you all could expand to be able to give more services, but potentially do it in a way that is slightly different than how you're thinking about doing it? I'm just curious if that's been explored.
Maryland Corps has not been explored.
Okay.
But we will do that. For this particular management aid position, we will be looking for someone who has worked for an animal agency and kind of knows the business a little bit. But Maryland Corps in general could certainly help us overall.
Yeah. Okay, thank you.
To piggyback on that, have y'all ever considered having more than one location in the county?
More than one location means a lot more staff.
Right.
So that would be amazing, even if it was an auxiliary just adoption center. So that's the model. When I worked in DC, we had 2 different shelters. When I was in Albuquerque, we had an east side and a west side. To cut down on really ballooning staffing needs, one of them could just be an adoption center. So I love the idea. Yeah.
Just because thinking, we're a very large county, like Mr. Volke is doing that, and that, to have something in that section of the county, it's t'other. So just, we all have those dreams of someday, perhaps.
Yes, we do.
So, all right. Ms. Ledbetter.
Oh, thank you, Madam Chair. A comment and then a question. I love that idea that the idea of combining seniors with pets, and then even the library, where I know I don't know if it's the Friends group that runs it or if it's you that runs it, but it's where you can come and read I've seen, I think high schoolers sometimes come and they read to pets.
That's actually the SPCA.
Just SPCA. Okay. Well.
But it's good.
But it's, regardless of who's doing it, it's a creative way of getting people involved with animals who need more socialization. So what a really cool idea, Mr. Volke. My question is about, do you track return rates? I know that's a touchy subject. None of us like to see an animal adopted and then returned, but sometimes the unforeseen does happen. Do you keep track of what your return rate is?
We're better able to track it now. I do believe it's gone down over the past, say, 3 years. I don't have the number in front of me right now. It's not alarming, but of course we want to see that rate go down, and some of that gets back to successful adoption. Very often it's about expectations. So being able to have those conversations, trying to make the right match. But you're right, returns will happen, and adopters that end up deciding to return an animal, it's very hard on them. So we also try to flip if it doesn't work out, doesn't mean you failed. So kind of changing the attitude about it, not saying, oh, just bring them back whenever, but yeah.
Well, and where I was going with this too is that one of the goals of having the new position?
Yes.
Is to help, because more counseling
right
ahead of time, more assistance ahead of time might help reduce those return rates.
Exactly.
That'd be a great metric to have a before, and assuming it's funded, and after, so that we could prove the efficacy of the new position. Thank you.
Ms. Fiedler.
Thank you, Madam Chair. I'm going to dovetail off of that. There's been conversations with the library and District 5 and a library. If there was ever a potential for doing a library and a location with you guys, you could read to pets if you were by a library. So,
We could do a
private
lot.
public partnerships. Let's talk. But I wanted to follow up on the pig bill that we passed. Sorry, Alfred's coming back. I know that you all have rescued and held and then placed several miniature pigs. Do you find that your tools for corralling are sufficient? I know that that was a concern during the bill, but you answered appropriately that you have what you need.
We do have what we need, and
Okay.
we've had 4 pigs come through, yeah, and they've been placed. A rescue group has found them placement. We do have what we need.
Okay.
Thank
And
you for
then-
asking that, though.
Yeah, and then Friends, obviously nonprofit, just throwing it out there. I know that there's a long-term plan for Crownsville. It's a very large property, a lot of history there. I'm certainly not suggesting that we do anything there in a historical area that's planned for remembrance, but I know that there's a lot of asphalt too. So if the county is ever looking at that, I think that's a central location as well. And that in that note, you had mentioned the cost associated with the capital improvement project for relocation. Just for the record clarification, it's 530,000, not million, correct?
Yeah, I hope I didn't say
Okay,
million.
I didn't want people emailing us like,
That would be quite an animal.
that's a really
control
nice
center. Wow.
schwanky.
Very schwanky. The spa, we may all want to go stay there.
530,000.
Thank you for clarifying.
You're welcome.
Yes.
Thank you.
Okay. All right. So I have to ask the question, what is the most unusual animal y'all have taken in this year?
Nothing really off the charts.
Man, I was hoping something really strange.
No, like we haven't had any alligators. We had a couple caiman when I lived in DC. No, I mean the handful of pigs, we have some roosters and chickens and some snakes, various reptiles, but
nothing.
nah, sorry, I got nothing.
Oh, man, it's kind of, okay. I was hoping something really odd. I know y'all were working with an owner with a kangaroo, so but you didn't take him in, but you
The
were.
kangaroo did not hit the shelter, no.
That would have been, I want to see which volunteer was offering to take care of that one. Do y'all have, I know some of the other departments have done this over the years to really help a designated staff person whose job is grants to search for and apply for grants. Do y'all have someone in your office that does that?
We don't. It is something as I get to the 2-year mark, something that I want to look at is being able to get more grants.
Because
For sure.
I think there's lots out there.
There's a ton, and having spent most of my animal welfare career in nonprofits, I'm familiar with the players and know some of them personally, so I think there's some things we could do.
That would have that, because as we look forward to the new facility, I would imagine that there are a large number of options that may be out there to help with the funding for that to have. And so I'll just put a plug in future budgets. Maybe that's something to include, is to have somebody that could be out there to maximize what we have bring in. So, all right. Any further questions for Animal Services? All right. Thank you very much. Next time, please bring a pet with you that as a visual aid.
I
so we
will.
can
I
see-
thought about bringing my own little Quinn who has a uniform shirt, but
Oh, that would be great.
next time.
Or you could bring a snake in, or the kangaroo.
Quinn's more of an overall people pleaser, so.
There we go. All right. Thank you very much. Next up is the fire department. Yes, hold on. Everybody's jumping up and stretch. Give us a moment to stretch. Okay, we're ready. Chief Wolford, welcome.
Good morning. I'm Kyle Madden from the Budget Office. You can find the fire department's budget on page 294 of the budget book, and I will turn it over to the chief.
Hey, good morning. Great to see everyone. Thank you for the time and attention. I always like to start with a thank you for all the years that we've done budget together and everything that you've afforded the department. I did sit here and evaluate my life choices, listening to Claudia talk about basically a dog library that you can check out dogs. And I'm thinking, what are we doing wrong in life? Because that must be the coolest director position. I will say we have a meeting with Claudia and her team tomorrow, and we'll be unveiling a cool little project that we've been working on together between firefighters and pets. So something. Well, if she has some, certainly, yes, whatever is there. So we hope so. We're gonna dig right in. You all are very familiar with the fire department. I always appreciate your support and listening and asking questions. So we will get started with operating. Everything you see on the screen, we're going to go through slide by slide, but this is where you can see the money is being spent on changes for our operating budget and hopefully new items coming into the department. We're going to start with the biggest one, which is staffing, and this is the 21 positions to address the standards of cover document and kind of our first steps of moving through that document that all of you have received. We also did Zoom meeting briefings to ask any questions, and then I did some follow-up with some of the priorities. I should pause for a moment. I did not introduce the rest of the team, and I wanted to make sure we do that real quick. So Deputy Chief Tom Young to my left. We also have Darlene Flynn, our budget analyst, and then Division Chief Michael Faltzcraft. This will be your panel of experts when we get into Q&A, and we always thank the Budget Office for being here for any additional questions, capital or operating. So back to our new service, which is the Truck One staffing. This is primarily a major impact into our South County area. This begins to eliminate one of our priorities, which is cross-staffing that we want to get rid of. Cross-staffing is when you have one crew that operates on two separate pieces of apparatus. So if the crew gets on the engine, that means a truck is left behind in the station and not staffed. That is probably one of our highest priorities in our standards of cover document. So this not only adds additional staffing, it also eliminates cross-staffing at our Galesville Fire Station. You can see the start date on there. And then also that we do have the bandwidth to be welcoming new folks into the department to manage this staffing. LifePack 35s, this is probably a paramedic's most chosen tool and is probably the most impactful tool to our community members. This does everything cardiac that we need, blood pressures, our ability to defibrillate, our ability to be able to speak through data to our hospitals. What's happening is our current LifePack 15s are phasing out. They will no longer be available. We have to make a full switch over to the newest product, which is LifePack 35. There are other vendors. This has been the best product for us. We've been with LifePack for quite some time, but we can't risk the dangers of training folks with our current LifePack 15 and the LifePack 35. This impacts the entire county, so every firehouse, along with our EMS officers, our training officers. So it is a big ask, but it's one that we have to jump from one to the other. We will be in a position very shortly to not be able to service these also. So as those come out of service, we literally cannot have paramedics functioning without these life packs. So this is the transition from one to the other, along with some of the technicalities of the upgrade and how that will serve us better, meaning that communication to the hospital. So when we're in the back of a unit working, that data transmission to the hospital they have on our arrival, it really cuts down on the patient face-to-face time that we have to do when we get to the hospital. It allows the hospital to be prepped and ready to go, whether that's an immediate movement upstairs to the cath lab, immediate movement to pediatric labs, whatever it is, the hospital is really prepared and ready to go with everything that we have information before we get to the location of the hospital. Medication and medical supply, this along with mobile integrated health. Let me hit mobile integrated health because I think you all are very familiar with that program. And the reason these two are together on the slide is because both of the medication supply and mobile integrated health has been a partnership with our hospitals. What's been rapidly happening is we love our hospital partners, but they're pulling away from the funding. And so they've pulled away from the funding of our mobile integrated health program, which has a huge impact. These are our high utilizers in our 911 system. These are high utilizers that normally have low needs, low acuity needs, such as perhaps they need a walker in their home. Perhaps they're calling 911 multiple times a month, sometimes 20, 25 times a month for falls within the home. And then we realize they have a walker, but they also have shag carpet. And what they need is linoleum flooring or things like that. Or nobody in their family, or they have nobody caretaking them, and they have no pill medication boxes to keep their medications separate. So they're incurring unintentional overdoses. So what this program does is it's funded with our Department of Aging, a great partnership, and then also with a nurse and a paramedic. And we go into the home on a scheduled basis. This is not a response to 911. It's a Monday through Friday scheduled. And we look at their needs and we really try to address their individual needs for quality of life. And then also things that help reduce the call volume coming into our 911 center. So highly successful. But we are having to fund that on our own. This is a program I am unwilling to release and unwilling for the county not to have. It's too impactful. So it's the money for continuing to fund that with our partners in Department of Aging. And then the medication and medical supply. Normally, once ambulances, medic units go to the hospital, they receive everything they need to refill what they've used on the previous call. Medications specifically. That's no longer happening, and that's been really a rapid progression of change, which means we are now responsible as a fire department for medical drugs, which means in our quartermaster, I have to have somebody responsible for not only the security of that, the ordering of it, where those drugs are held. Some of them have to be refrigerated, some of them are temperature controlled. It's a huge lift. We saw it coming last year. We didn't know it would make a full turn with all the hospitals that we would be responsible. But unfortunately, this is where we are. It's an absolute necessity. We have to have it to continue our EMS care. We're just going to have to manage it from the inside. I will say we're doing the best we can. We are not fully thought out of how the space is going to work. We are to make it work right now, but long term, I'm not sure if we have enough space off of Grover Road at our quartermaster there. We're taking a swing at what we think the staffing should be. Obviously, I'm being very fiscally responsible with the request. Somebody to manage the program, somebody to make sure that all the safety and security benchmarks are in place. But I don't have a comparison. We haven't done this. So we're just trying to be thoughtful. I say all that because I'm not sure how heavy the lift is going to be. I think we have it. But I think every firefighter thinks they have it until they don't. So I'm just kind of putting it all out there that this is the request and that we're hoping our pre-hospital care will stay very neutral and that our customers nor the department will feel a huge blip in what this will take. So this is the initial request here. Apparatus replacement, I've tried to always be very thoughtful with all of you about giving you a plan and sticking to a plan, and we are still on a plan. Our apparatus fleet is still incredibly deficient and almost horrific. These are things that you all experience. You can't change what your predecessors had to do or made choices to do. So this is nothing against previous chiefs, previous administrations. It's just where we are. But anywhere up to 14 to 17 years ago, when apparatus in that time frame was unable to be purchased, we are now feeling the effects of it. Apparatus is good for 25 years, and then it has to go on the shelf, basically. Our program puts new apparatus into service for anywhere from 8 to 12 years, and then we need to remove it and put it in our reserve fleet so that we have a healthy reserve fleet. So when something happens, we have an in and out process and we don't lose service time in the community. That's the biggest thing, is losing resources or losing time where apparatus is on the street, making sure that it's serving the community. So this is part of the replacement. As long as I'm here, you all will always see apparatus replacement needs. It's not going to get any easier. It's not going to get any shorter. We are working on a national level to reduce the cost of apparatus, which has become unbearable and astronomical. Along with the order times, you can see almost 3 years to receive apparatus. So what we do now, some of us may not see. So 3 years is a gift at this point. Some of them have taken up to 4. We used to receive apparatus in about 18 months, and certainly at a lower cost. Our hands are tied with the cost and the timeline until we can literally get the White House and all of our national players to really apply decent pressure, which we've been working on for over a year. So it's always going to be a hefty ask based on the price, but that's one thing I can't control. Additional uniforms, gear, again, this is all one time. You'll see the first one is the replacement of our ballistic vests, our ballistic shields. I hate that we live in a day and an age that we absolutely need this, but we do. This is part of our partnership in being able to move into what we consider hot zone or warm zone with our police partners to immediately be able to treat or triage if we have mass casualty events. Again, these are things that we just need. This is to keep our providers safe that are willing to go into these areas, that have been trained to provide medical care, along with understanding the risk that's involved. This is not shields and vests for everyone. These are supplies that we carry in certain response vehicles. So it will be on scene when needed for a certain amount of people. The next piece is a contract negotiated with our IAFF. So again, this is part of what comes through the negotiations with IAFF and the county. This supplies them with the second set of boots, second helmet. This is in order for them to switch out dirty gear versus clean gear as we, continue the crusade against carcinogens and cancer in our firefighters. And then the uniforms, again, just making sure we're being extremely thorough with those 21 new positions and including all the cost so that we just don't manage the cost for a pin and then go, oh, by the way, we need a little bit of this, we need a little bit of that. Contractual and temporary staffing, we're working with OIT and our public safety partners. We'll be getting a new CAD dispatch program. That's our 911 dispatch that works in those centers for us. This is what covers part of the overtime that will be required by our folks to be in there, making sure that the switchover is clean, that the integration works the way we need to work. The second piece is we have a deputy chief retiring. So this is the succession planning of the overlap of when we do promotions. It's a big position. We're very lean at the top when it comes to the organization. Myself, an assistant chief managing operations, which is fire and EMS, and then 2 deputy chiefs. So Chief Young is one of them. Chief Novak will be retiring. So this is the succession plan of what it will cost for the time to have a double encumbrance before the retirement in December. The contractual manager, again, for the medical supply that we discussed. Our HR, we've gone to bat for getting HR payroll assistance for many years. We have over 1,000 staff and we have 2 people. They basically split the alphabet in half and work miracles, because I don't know any other agency in the county that's using 2 for 1,000 people on payroll. And I will say our payroll is extremely unique with our shift model. So we have people on 10s and 14s, we have people on day work, we have people on 10-hour days, 8-hour days, 24/72. We have a very unique system. Again, this is a mini ask to a much larger ask that will probably come in future years. I always try to be very responsible with our money and how we spend that, knowing we are a very expensive agency. That is not lost on me, that our tools and our commitment to the community and our firefighters is expensive. So we're hoping this will help, but I'm going to let you know it's just the beginning of probably some additional requests in future years. More equipment and one-time costs. Our pediatric response system. The unique thing about this is kids are highly complicated medical patients, along with the emotions run very high. This pediatric response system will not only help all ages of children, it has the opportunity to help kind of our middle-aged young adults. The unique thing about this system is we switch protocols every year. Our medical protocols mandated by the state get changed or upgraded, not all of them, but a certain part of them. This system allows that protocol change to happen within the equipment so that they don't have to worry about one standard equipment and then looking at maybe their iPad or the protocol book to make sure the changes match what is in the recommendations for pediatric drug doses, pediatric size of intubation, things like that that are much smaller and much more difficult. So that's really something that will be very beneficial to our providers in the field, along with how we train them. So that is the big portion of that. You'll see it's not just the system, but it's that IT piece that keeps the protocols up to date year to year. The replacement of our monitors for our chemical identifiers through our hazmat system. We are in a day and age where the chemicals change quite often. The dangers are lots of times unknown. We just needed a better monitor to be able to identify more hazards and that we know them quicker so we're able to mitigate sooner. Fireboat 41, the boat slip charges, you'll see one time. The permanent boat slip being under construction, we knew with the new fireboats coming in, we were not going to have the adequate space based on them being longer and bigger. So this has really been the conversation that just has held over as we get to the replacement and making sure that we have the proper things for the permanent boat slip that'll be under construction. Rope replacement, again, some of these things seem small, but trying to be very thoughtful. The team sitting in front of you can literally tell you where almost every nickel and dime is spent in this department, and can do so very clean conscious, being able to speak to the community on every dollar that's being spent that's coming in. So this is our rope replacement as it reaches its end of life, being replaced at 10 years. I'll pause with operational. I'm happy to go back to any of the slides, and the team here in front of you can answer any questions before we move into our capital.
Ms. Fiedler.
Thank you, Madam Chair. Thank you for rolling through that very efficiently. I appreciate it. Can you go back to the medication refill? What happened? So the hospitals were refilling. And was there a change in state law in the hospital's decision-making?
It was a financial decision based on our hospitals. There's no law that I'm aware of that anybody else is aware of. So I think it's, my best guess is, after COVID, and as we move through some of those partnerships and the funding and the capabilities of funding, it's not lost on me that everyone is struggling. So this is when, we have a couple of major hospital partners in Anne Arundel County, and they are wonderful partners. It just got to a point that they said we are going to be unable to do this, and we tried to make it last as long as we can. One hospital fell short sooner than the other, but we are now at a point that both of our major hospitals are not providing this for us.
Are there a set of standard medications that you know that you are going to need to refill the ambulances, or do you have to have everything? I mean,
we're going to have everything, and we understand the management of that to a smaller degree. Our EMS officers are not only running high acuity calls, they're also, responding to fire emergencies, but some of their responsibility is to allocate drugs that need to be secured to different medical units across the county. So depending on what is used by each provider and how much they have within their storage to get through a whole shift, unfortunately, we've seen things like lots of drug overdoses in a single day, depending on which direction of the county new drugs have come in. And we'll go through a lot of Narcan, and they will think they have enough for the day. And instead, the EMS officer has to be able to come out to them, meet them at the station, meet them at the hospital, and say, here's additional milligrams of Narcan, where in times you could get some of that from the hospital, you could refill, those types of things. But we're also talking supplies of nasal cannulas, non-rebreather masks. It's going to be a lot.
You mentioned having it at one central location. Was that right? Did I understand that right?
We have to have a central location to inventory, to store, and then we'll be able to distribute throughout there. Again, we're working through the process. I'm happy to have either of my colleagues, either of the chiefs, comment on how we're going to do distribution, how we expect to do that. It's, it's also taking folks that are already working in logistics to start to manage this on the side. We do have inventory control based on some of our technology, but I'm not sure how capable it's going to be to the extent that we need. I hate to sit up here and not be able to answer your questions, but there is a lot of unknown because it was a rapid transition. And we weren't sure we were going to have to do it. Last budget fiscal cycle, we talked about having to mainly think about transitioning to it, and we did. So we're not unprepared, but we also don't know the scope of how that's going to play out based on our technology, based on distribution, those types of things.
Has there been any discussion on going back to our hospital partners and sharing, doing like a cost sharing? Because I'm thinking about it from, an on the ground perspective. It's so much easier to refill when you're going to these locations and they have the controls already set up versus us trying to figure out. I mean, it's just not efficient to go back to one location in the county. And if you're going to have several locations in several different firehouses, you have to have those control measures set up there.
We do have all of those set up. It's
They
not.
are already
Yes,
set up.
yeah. Please don't.
Okay.
If I'm representing it as it's completely uncontrolled, it's not. There are
Okay.
very secure measures. Each provider is very secure in who can access.
Okay.
We have lock boxes. Everything at the station level is very secure. My concern is these are not new things we put our hands on. It's a new system, and I'm not sure the volume and what that will look like when it comes to storage and management. But nothing is new to us. All of our safety and security protocols are all within our realm. Everybody is well-versed, trained, qualified. So it's just a little bit of the unknown of that transition. I do want to speak to our partnerships, and we have had a lot of conversation. I don't know how many times I have said, if the fire chief could also be the CEO of the hospitals, I wouldn't wish that upon anyone, but it is our closest partnership that affects our EMS personnel by far the greatest of what can be satisfying to an EMS provider in the field and what can be satisfying to the hospital employees and how they need to function. So we try our best. The operations chief holds weekly meetings, and we've held weekly meetings almost since the time he got here, which is now 6 years ago, in order to make sure that we have good wait times, that we have good relationships, and we do. I couldn't speak to exactly the hospital's decision. I just know that the outcome has been placed on us and we're managing it as best as possible.
Okay, I appreciate that. I'm not surprised that you had answers at the ready and that there are safeguards there. I'm surprised that it's happening, but I understand the positions of both parties. Interested to continue to hear from the department on how this unrolls and unfolds as you all start taking on that responsibility.
I'm happy to provide updates once we're into it to see how it's going. And certainly if it creates any additional requests or struggles. And we're not going to discontinue conversation with the hospitals because I think there's always something to be learned, or we can evolve into maybe a better shared process like you were speaking of.
Great, thank you.
Ms. Rodby.
Thank you. My colleague asked many of the questions that I also was thinking, but I wanted to just ask one more. In my mind, this sounds incredibly inefficient compared to the system that was in place. Do you feel like that's an accurate characterization?
Tough question, because I can honestly say that anything the fire department does is efficient. So I know my folks are extremely good at what they do, and they'll be able to pivot and learn. So I don't think we will be inefficient. There is never a goal that we don't get ourselves to. I don't know for certain the challenges within the hospital, and I always try to figure out, well, if it was me as a director and I had to make that decision to one of my partners, I don't know clearly their struggles. And if we were going to become inefficient based on what was happening within the hospitals. So that could have been a possibility, right? I try to see both sides of the story. So for our clinicians in the field, we will not be inefficient. The community will never feel a blip. I can say that for certain. So
that wasn't, I mean, I have zero doubt that you will be efficient with how you operate. I guess I'm thinking from a practical standpoint in terms of, you know, when you're talking about, you know, sort of distributing the needs to the various, you know, ambulances or to the, you know, various individuals involved, it was already happening at a point where there was, you know, someone was already making it, like if I'm understanding the system that was in place, an ambulance was already making a trip to the hospital and the resupply was happening at that time?
Yes, ma'am.
So in that way, there's a whole new set of trips that are going to be created. And not, you know, again, not criticizing the efficiency of the fire department. I know you, like I said, I know you will do it as much as, you know, as efficiently as possible, but that is a whole new set of trips and moving around of resources, even though they're tiny resources, but they're very fragile and need to be secured and temperature monitored, like you said, that you did not have before. So I'm very curious. I think my colleague mentioned cost sharing, and I'm wondering if that's even something that is worth exploring, or is this ship so far sailed?
Always, yeah, no, always worth exploring. I'm sorry, please go ahead.
No, that was just to suggest, you know, hey, is what they need, you know, and maybe there was reimbursement already happening, but, you know, is it they need reimbursement for their, you know, for this service that they're providing or something like that, that actually still, and that might actually provide cost saving to the county without having to add all those additional trips?
Yes, for the conversation to continue. I'm not sure that the process and the outcome, I can feel Chief Young over here wanting to answer. I'm going to turn it over to him in a minute if he has anything to add. It doesn't always mean that there will be additional trips. It might be a change in how we stock our units. It might be the availability of the location of within our 4 battalions in the fire department, we have substations that are secured to be able to allocate those medications and supplies. And that's most of the thing, almost like your vending machine approach, where you can be able to, as a provider, it's secure, punch in your code, receive what you need from the previous call. So it could be back at your station or within a very manageable reach of that. So I'm not making the assumption that it is always a trip to our main, right? I'm visualizing you seeing this main center point in the county and then all of these ambulances running back and forth. That is not our definition of productive or efficient with the apparatus, with the fuel, with the time. So there are plans in place to be doing something different that would allow members to be able to stock differently or to reach within their battalion. I'll turn it over to Chief Young, who appears to have something. I like it.
I just wanted to reinforce the fact that we already do have restock medications and supplies at all the fire stations and in each medic unit. What this is we now have to have the main stock. It's not coming from the hospital at all. It have to be at our logistics center. And a lot of the struggle that the chief's talking about is we need to measure what is our stock. As we have expiration dates, things like that, we need to make sure we don't overstock. We need to not make sure we don't understock. There will also be, that's why there's a vehicle involved with this management supply person to make sure they can get around to the stations to restock certain medications. But so it's kind of balancing where the levels are, but we already currently do have the ability to just go from the hospital directly to another incident, that we don't have to necessarily restock every single time. But after a certain, maybe 1 or 2 calls, we would get restocked at the hospital. We'll just have to do that now back at the station or have one of the supervisors meet at the hospital. They're also looking at having vending machines for our medications at the hospitals for our providers to be able to get the medications if they need to, just we would be the ones stocking that machine.
Mr. Volke.
colleagues ask this question, I'll ask it. Would it be more efficient to just say to the hospital, tell us what it would cost for us to get this from you, and have you keep doing it? Yeah.
That's, we did ask that.
Okay.
They were unwilling.
Did they give us a reason as to why they were unwilling?
I
Seems
did
like it would
not
be-
receive a reason from my CEO partners.
They just said no with no explanation.
They informed us they would be discontinuing the service and gave us a very short lead time.
Was this done in writing?
I believe we do have it in writing.
I guess I'm just we need to be a little pushier. That's where I'm coming from. Like I think we need to go back to them and say, look, we've been good partners to you on a lot of things. You guys are great operators. Nobody's trying to make anybody look like a bad person here. But I mean, we had this with Anne Arundel Medical Center when we were doing the detention center, and they wouldn't let people keep parking in the garage, and the surface lots and stuff. I mean, it's very frustrating because we have funded significant capital improvements for them, and we look at them as partners, but a partnership is a give and take, and so it's got to be both ways. And I think, I guess what I'm saying is, this is a significant cost to the county. It's a significant logistical thing to figure out for you all. I think before we fund this as a council, I think we really need to kind of go in there and see how much more we can get.
So what I can
better
say
deals,
is, we are very pushy. I consider myself somewhat of a gnat, right?
I've been on the other side of it, so
Yes.
I get it.
So, when there's things that we need and then we want, I try to be very eloquent in my wording. But I also believe it's good to be a mosquito and buzz in your ear for a long time. I should apologize because what I didn't take into account is we've been fighting this battle for over a year. So what you see from the column up here is the fact that we have gone to battle. And then when I introduce it to you all are exactly the way I was, besides fuming from having good partnerships, right? Because you feel like if you are a good partner, and I try to be a good partner with everyone, that gets reciprocated. I also understand they have a very different business model than what my business model is and what our mission is. So what I see unfolding in front of me is exactly how you all feel and where we were a year ago when we fought tooth and nail. We have been unrelenting. I will say the EMS division under operations has gone to battle, has gone to bat. We've all poked and prodded. We've all insisted. The thing that can't happen and what makes me nervous is when you say we should hold the funding, because no matter what, we're doing medication right now. I can't change that.
I don't think anybody said hold funding. I think we don't have to pass a budget for another month, right? So to the extent that this has to get funded, we've got T-1 month to be pushy.
Would you all be willing to come with me for those conversations? Because
I'm
I have not been
literally texting the
impactful.
hospital right now. Like yes. The answer I think for all of us is yes. Yes.
It's going to take a lot, and I don't know that they're going to be willing. They have been unwilling at this point, so.
So if I may, is this happening across the state, or is this solely happening in Anne Arundel County? Is this something like the hospital association is involved with it? I mean, we had one hospital
That's an
and
excellent
then they
question.
all sort of, is every jurisdiction setting up the same situation? We're creating basically a pharmacy within our fire department, and it seems super inefficient for so many reasons to serve a shared constituency. I realize our hospitals here in the county, but you are also driving to patients outside the county. So is this just been a waterfall effect? Because this seems like, if it is, and it's happening in every jurisdiction, this seems like a bigger conversation and issue than just Anne Arundel County Fire Department and our two hospitals.
Chief Young just used the phrase industry trend.
An industry trend. Well, I know we're seeing cost shifts from the state, we're seeing that. And at some point, we're going to have to maybe pull together across jurisdictions to figure out, it's just so incredibly inefficient. It doesn't make sense. Even if it'd be almost better to have not personnel, but a billing system would be more cost effective than setting up our own county pharmacy. That's crazy to me. But if it is happening across the state and across the country, then we're not getting, obviously we're late to the party here. We're not trying to, I'm sure you've done all of this kind of conversations, but it just seems insane, a little insane.
I appreciate that you all feel the same way I do. I do, right? I try to come up here and be calm and collect and not make my face go red because, right, it like builds that little ball of fury in your stomach. And at the same time, understanding it's a very thin line to walk because we are not successful without the success of our hospital partners in multiple areas. So I'm in a bit of a position to continue to be a gnat or a mosquito. But also understand there's other things that we continue to work on with the hospitals. It's certainly not where we want to be. This is not how we intended to be requesting or spending our money.
I mean, unless I feel like we're missing something from their rationale. Is it risk management on their part? Is it more legal question rather than a financial question? Like, is it all of the above? It seems like we should all be able to put our critical thinking, what are we missing? I feel like we're missing something. This seems so ridiculous.
Insurance companies and money. I'm sorry to throw my thoughts in, but.
We should be getting an email.
If it's okay with the dais, we'll go back. We'll go back through our records of the why. We can reach out for a very specific why, if you're okay with me saying, based on my interactions with our council members, understanding a greater why in that sense. And then I'll be able to provide that to you. We'll put a normal deadline of a response back from our hospital systems and see what I can get for you.
But again, this is also hospitals outside of our county.
I've seen it happening in other states.
Okay. This is happening when y'all drive an ambulance and a patient to Mercy or wherever you might be taking them. This hasn't started yet. We're going to have to start this.
So a lot of the hospitals outside of Anne Arundel County, we don't have the same in-kind processes. So we just know we go to those hospitals. If we go to DC, if we go to shock trauma, we go to those hospitals. We know we have enough to get, put us back in service, or they're returning out of service for decon, cleanup, and restock coming from an outside agency. The concern is more within Anne Arundel County and our local partnerships here.
And real quick, when are they making the shift? Or
one is already shifted, and we expect the other one by the end of the year. They both have. Yes, my apologies.
Who shifted already?
Both have now. One shifted before the other. So Anne Arundel Medical Center and Baltimore Washington Medical Center.
So they shifted before you could include this and build it into your budget. They shifted this cost over.
Yes, ma'am.
And who went when?
I'd have to go back and look at the dates. I'll get you the information.
Okay. Great, thank you.
One was months before the other.
Okay. I have more questions, but I'm happy to let other people go if they want to jump in.
Okay, let me get Mr. Smith and we'll work that down. Mr. Smith.
Quick. Feel the same way they feel. I was going to ask some of those questions, but no need for me to belabor that whole process, that conversation. On the recruiting, same thing with the police that we had asked, is that recruiting and the attrition rate, are they 1-on-1, or are we losing folks while we're still trying to gain? Like, what does that look like over the last year, I would say?
Very consistent for recruitment. We always have a multitude of people in the queue. What we have found is the resiliency of people making it through the process has changed with generations, but we never have a shortage of applications. We always have hundreds, if not over 1,000, for sometimes anywhere between 20 to 70 positions. So we always have the opportunity to process people. The conversation we're working on right now with Anne and her team at the Office of Personnel is that continuous recruitment and hiring, not hiring to put them on the street, but to move them through the process instead of a one testing model. Right now, they test once in June for entry level. And again, a lot of the generational change that we're learning is the instant gratification, right, that you get off of social media. So when folks show interest, we want to be able to start moving them through the process.
When is that test in June?
The date is, I don't have it in front of me.
Is it after our budget? Like, is it like the second half of June?
It's going to be mid to late.
Okay. So that 21 that's in this position, we already have those people queued up, or like when would they start?
They
Or
will
go
start,
through the
you have
process?
the, well, because they're for the summer. They're being processed.
Yeah, it'd be January class, probably January 15th or 16th, whatever that second pay period is. But
Is
they
there-
would be out of this hiring process. We will begin in June. We'll
When-
probably
when-
make the
when is
announcement
next
in
cla-
May.
So the next class is January?
So we do 2 classes a year now in our model. And so we plan to have a class in July, starting July 16th, which is a smaller class. Right now, we're planning for 20. That's based on our attrition data, because we are in a good place with our attrition. In fact, in December, we were at 0 vacancies with retirements, and we're up to about about a dozen now vacancies. So the 20 is the proper number for attrition purposes. That's in July, and those persons will come from the hiring process we did last June. And so this process we're getting ready to start, the process takes about 6 months. It'll go all the way into November, and the selections will be in December for a class starting mid-January. And that class would include these 21 in the budget request.
And the uniforms and all that stuff will just that'll be funded with this $27 for the January class.
Correct.
With your folks that are on like sick leave or sickly, is that a big portion of your population, folks that are injured and things like that, that are not operational? And so they're just assigned to, is that a big portion of your population?
Right now, it's a bigger portion than we would like. The number is higher than we've had in the past. We've been working with risk management and the team over there. So if you allow me, so a part of what we do in our fitness and health and wellness is try to identify common injuries that we're seeing in that batch of people. Right now, we're seeing a lot of shoulders. So then they go back, shoulder injuries. So they go back and try to mitigate based on wellness practices, things to change about 3 points of contact, body mechanics to try and lower that number. So we look at it from a wellness standpoint. And then we also look at the process of how we're processing the paperwork through all of that, the types of injuries to get that number down. It is much higher than we would like. So if we can get that number down, that would be more successful.
Yeah, I just know that we have the same thing in, obviously, in the military. There are folks that impact our operational capability, because even though we're full, a third or maybe 20% is obviously waiting either in school or they are in some sort of limited duty capacity. So I just want to make sure our output is not impacted by that large number or whatever the number is. And so, and then the last question was, I know the administration, I think they talked about this at one of the budget hearings, the SAFER grants. Are you in favor of those? I know this year the federal government has had a 2-year, like it's still, I don't know if it's open or closed, but I know 25 or it's like a double year where they're still accepting it. I don't recall where it's been not funded over the last 8 years, not necessarily ours, but the program itself. Is that something that would benefit the fire department, and are you in support of those types of
Very
resources?
much in favor of the SAFER grant, very much in favor of that for increasing our staffing that we know we need to do. The application process has not been open with DHS being closed, even with the partial opening of DHS or moving through full opening of DHS, that application process is still not open. Part of the work we do on the national level is even if the grant application is not available, we would still like the opportunity for it to be open. So those of us with July 1 budgets have the opportunity. It could potentially open at any time across the year. But what we're waiting to see happen on a national level is the reimbursement funding of folks already on the SAFER grant to receive that refund and reimbursement on a regular basis. The shutdown stops that also. So we hope in future years, we received a SAFER grant my first year here that we accepted for 50 positions. We would love the opportunity to do that again. What's changed over the years, and maybe what you're speaking to, is the allocated funding or percentage of funding that happens over a 3-year period. We've seen periods of 75% is the grant, 25% is the local jurisdiction. Year 1, same thing for year 2, and then year 3 that flips, where the agency is responsible for 75%, the government is 25%. In previous years, we've seen all 3 years being funded by the federal government, knowing the agency and the county would pick up the 4th and any years after that. Everything for SAFER grant must be operational. Those must be new pins into the field. And then there is also a clause in there about layoffs and furloughs and things like that. So we would love for it to open. I'm a huge fan. I think it's a great way to begin integrating in a cost-sharing way what it's going to take to really expand the department and get rid of, some of those needs we have in our standards of cover.
Thank you. Appreciate it.
Ms. Pickard. Ms. Rodvian.
I think I just needed to express my outrage along with you. To me, this seems like just another way that our healthcare system is failing and chipping away at all of us. That's all.
Thank you. I appreciate that.
Thank you, Madam Chair. I could go on and on about the medication. I won't, but I could. I want to circle back to the life pack replacement, just to make sure I understand the longevity of those units. At first I saw 2008 and I'm like, oh, they last 9 to 10 years. Yeah, it's been a little longer than that. So are they about a 20-year lifespan?
15.
15.
I think the only concern that we should be aware of is based on how rapidly technology changes and how much of those advancements through technology could really increase patient survivability. To me, those would be the only things that would change whether or not we would be back in 7 years or 12 years or those types of things, because we are seeing a rapid progression of medically what that's able to do for patient care.
So you don't wait for them to die is a bad word to use here, but you don't wait for them to be unusable. You try to estimate when the next iteration of them will come based on how fast the technology is improving. So what might be 15 years right now might be 10 years as the technology gets faster.
This is us staying ahead so that we don't get to a position where they can't service it or things, kind of stop working. We also try and be very thoughtful of how quickly we are changing such an important piece of equipment because there is a familiarity and a learning curve, right? Everybody gets comfortable with having that perfect new car type thing. So we want to make sure that we don't get into a fatigue cycle of how rapidly we're changing the equipment for hundreds of providers in the field.
Right.
So this is us staying ahead. The hardest part about something this expensive is that it is one wholesale change. And normally we don't have to ask for that. We can normally talk about phasing or progression. It's just what it is. We've got to move all at once.
How many are there?
Total 54.
54. And I am not questioning replacing these. I just general curiosity.
Just out of curiosity.
Yeah. How much is one?
Oh, wow. Remember the part where I said we're really grateful and I'm sorry we're so expensive?
Please.
Normally in our budget, we've always had room to buy 5 new ones each year. And it's in the previous versions, we had that ongoing replacement so that we would never have the entire 54 needing to be replaced at once.
Okay.
And even when they changed from maybe a Life Pack 12 to a 15, they were pretty much the same, just the upgraded model. The technology has increased and changed so dramatically. It's such an improvement that they're not compatible. The cables don't plug in the same way. You can't take the leads off of this one and put it on one of the older ones. And also there's just so much more that this one can do. The interaction with the hospital, interaction with our medical director. He can, with this one, actually get online and interact with our providers real time in the middle of a code with this new monitor. So it's light years ahead, and but unfortunately, it requires an all-at-once upgrade.
Okay.
And once we do the all-at-once upgrade, thank you for bringing up we will then consider that staggered and continue with doing that. So we're never phasing everything all at once unless
Understood.
something major happens.
Great. That is very helpful. Thank you.
Mr. Volk.
Okay, thank you. Are there any grants available that would allow us to offset the cost of this? And if there are, have we applied for any of those? Sorry, I'm very stuffy.
Yeah, we did look to the local development council. We were hoping the assistance of firefighter grant would come out, which would this be perfect for that. Unfortunately, that's also held up with the CFR. So we're waiting to see what other opportunities come up, but so far there hasn't been anything, and time became an issue here.
Okay, is this something that could be funded through like the VLT funds or like, you know?
We did, we made that request.
Okay, but they haven't funded that.
Correct.
And why not?
You would have to ask them, sir.
Okay. Didn't know if, again, I'm asking what information you have, right? We're sitting here for the first time hearing this going.
Correct.
You've done all the due diligence. Tell us what we know so we can make decisions.
Correct. And these are things that we can't afford as we've, waited for AFG and SAFER to open up and put in for that, and it didn't. Video lottery, that didn't occur. Again, we're not asking anything frivolous throughout the entire budget. It is an absolute need, so we had to make sure to put it in.
Okay. All right. Can we talk about your new positions a little bit? So we've gotten some feedback from IAFF. I know some of us, I think all of us have gotten the emails. They're concerned, obviously, about the 21 positions and when that's coming online. And I think the way that you've structured that up is they're not going to come online until summer 2027. Is that right?
And can I just clarify, they're concerned about the timing or they're concerned about the 21 positions?
Well, probably both, but I think especially what I've heard about is the timing right now. I mean, I think always they would like to see more firefighters quickly in service, but the timing on this particular proposal is what they're asking about. What's the reason for the start in summer 2025?
I would have to defer to the budget office.
27, sorry.
27.
Get my years mixed.
The budget office decided to make the hire in the mid-year to fit it into the budget. We wanted to get the positions in. We did not have the funding to start them day one of the year, but we got them in halfway through the year.
I see. So similar concept to what we're talking about with Tanker 10 in Jacobsville and the idea that it's $500,000 to do it now, but if we defer until January and then we put the positions in and we can do it for $250, you kind of move that halfway through the year and then next year that cost is baked in. Yes?
Yes, sir. The only option that could be a possibility is we always plan for a certain attrition rate out of our training academy.
Sure.
And we've been making decreases, which has been fantastic. So if we were to happen to graduate the entire class that was hired, there is a potential because the tanker staffing is only 5 and not 21. There is a potential that we would be able to allocate those pins earlier if those positions remain filled through the entire training process. So I think that's a little bit of the only kind of wild card right there that could be helpful.
And I'm assuming that you're over hiring the class, understanding there's attrition when they go through.
What we do is in the beginning of the class, based on most likely the first 10 days, if somebody fails out or decides to drop out, changes their mind in the first 10 days, we have a couple per se on deck that are ready to go to really fill those so we don't lose that opportunity for them or for the taxpayer. But once you're well into the academy, they can't be replaced. There's no way they can catch up with the amount of information and education.
I got you. But, and again, you all do this all the time. I'm just asking questions, so understand that.
I love that. Yes, thank you.
Does it make sense to sort of, instead of keeping them on deck, bring them in, knowing that every class that you do, there's a certain number of people that go out, to the point that you've just made that obviously there's going to be a certain number of people who are too far along, but they drop, and you can't bring somebody in quickly. So like, for instance, if you know historically you've lost 5 people every class, you overstaff it basically, that class. Like overstaff it by 5, knowing odds are we're likely to lose them. Is that what you all do?
We did. Yes,
did.
we have moved in transition to,
Good.
Yes, but in past years, I would have had to say, no, we don't, but we do.
It seems like with all the data that we've got, that would be the right way to move forward, so that's good.
Another great partnership with Ann and the Office of Personnel and their willingness to work with us along with the budget office to be able to allow those pins to come into play for those things. So it takes a village.
Okay. And just so that I understand this, because I want to be clear for, there are people watching, there are people who come back and watch later. It sounds like the decision as to when to place particular firefighters into service and the timing on that was a budget office decision, not a fire department decision. Is that a fair way to put that?
Anytime
I don't
somebody
want to
asks.
blame the wrong person.
No. Anytime somebody asks me when we can put position in, my answer would always be sooner rather than later.
Okay.
I just know we have to be fiscally responsible, but I would certainly want them in sooner than later. Yes, sir.
Understood. So from an operational fire department standpoint, ASAP is the key. From a budget office standpoint, this was when the budget office and the county executive felt that they could make this work. Fair way to summarize?
I see head nods.
Can I,
I do too,
Yeah.
but I just,
can I interject?
please.
Even if these pins were budgeted for July 1, what is the lead time of actually recruiting, hiring, and training them? I mean, is that something, if we had unlimited funds and could hire them, are we prepared to hire 21 additional firefighters to start paying them on July 1st?
If we had unlimited funds, I would fill it with overtime, and I guarantee one of those spots would never go vacant. I would fill it with the folks we have right now, and they would scoop up every single one of them.
Yeah, but that doesn't get us to,
Just it would be the overtime being paid from July 1 until the moment the positions are ready to be filled. So the allocation of that overtime.
okay, but my question is, what is the lead time for bringing in 21 additional hires?
The quickest we could do it would be to bolster this next recruit class and to add in the 21 into the recruit class starting in July.
Okay.
And that would basically be doubling what you said, 20 from the July class, and doubling that to 41 to fill for the 21.
But we've not passed this budget yet.
Correct.
So we're not striking the budget till mid-June, June 11th. So from June 11th, when you know that they would be funded, you can find 21 bodies of qualified people? Okay.
That would be too short of a time frame.
Okay. So is there a possibility of running a recruit class, an academy class before January?
Yeah, we wouldn't. No, we wouldn't be able to make it through the background process they have to go through, and the CPAP process along with the testing process. That would incur a whole different
Because filling folks
financial.
with overtime, when we hear about our folks that are on light duty and our folks that are injured and our firefighters are exhausted, that's what we hear. So having them adding overtime, that gets us staffed up, but is that the most responsible thing to do with our current workforce? I'm just asking, it sounds like Mr. Trumbauer is.
Oh, he called in the big guns.
Thank you, and thanks to the chief and her team and everybody for explaining everything. I just wanted to clarify, because I've been listening to the back and forth, and I know what you guys are asking, and I know what you're saying, but I want to be clear. You guys will vote on the budget on June 11th, as scheduled. Those dollars don't become available officially till July 1st.
Of course.
Their recruit class starts in July. They can't miracle 21 new positions. You have to set that recruit class. You have to get all the spaces and all of that, right? So I just want to, it's true that the budget office did favor starting later because it costs less. And as you will see from this budget, we're trying to squeeze a lot in with limited resources, right? But there's also a logistical and timing issue for the reason that there are not 21 new positions starting in July, days after the money becomes available. And I think the chief answered that point when she said they have to do the background checks and they have to do all that. Now, there may be some operational way they can shove some overtime and things in like that, but I want to be clear that in addition to the financial constraint, there is also an operational timing issue from our perspective. And if I said anything wrong, the chief will tell me I'm wrong.
I do not think you said anything wrong.
Thank you, chief.
Can I keep going?
Sure.
Thanks. So, I just want to do let me be clear, right? I like that. I appreciate that.
May we add one more thing with Chief Young, with Chris's budget comments?
Yeah. Go ahead.
Anything to help clarify?
Just to be clear about a July class. So anybody hired in July will be from the hiring process that we did last June. And we hired the class in January of 26 off of that hiring process. So the next 20 will still be from that process. There could be an argument that there are people still available beyond 20 from that hiring process, but without knowing how many we can truly hire, it becomes logistically difficult to do because you can't give them you can't hire them without them going through backgrounds and medicals. And so to give them a conditional hire without knowing for sure if we have the funds to hire them makes it difficult to do. So that's why the attrition class set at 20, which is what we need to fill our attrition classes in July, is what we've moved forward with.
Part of what you would hear about, there's people waiting. There is a list. And this goes back to your original question about we only do a hiring and testing or a testing process in June. So the last two classes all came to us last June, which is that long waiting period. So there are more names on the perceived list, whether or not they're still available because they went somewhere else, or if we can call them forward to spend money to do the background, to do the CPAT test, all of that takes additional money. That's the timing piece that we struggle with. Are there names? Yes. Could we get them processed based on what we know right now in this moment or what we know in July? No. So people exist. Process and timing is the part of plugging that all together.
I get that. I also heard you say earlier, the fire department never misses a goal that you set. So if this is a goal, I know you guys will find a way to do it, right? I get that. I'm not zinging anybody. That's just a reality. And if we were to say to you today, we're going to put a budget amendment in a couple of weeks, and we're going to get you these positions sooner, I think you all would adjust to that reality, and you would say, okay, what can we do to try to fill that as quickly as possible? Because as you talked about, as soon as you have that authorization, whether it's through overtime, and I agree with what my colleague is saying, we do hear concerns about injuries and fatigue, et cetera. But as you've said, there are also plenty of people in the fire service who I think would jump at the opportunity to say, hey, OT, go down here, we can staff the one and we can do all of that. They'll jump at it, right? And you have folks who will do that. So my question for this kind of landing the plane, if you will, is what is the budget cost to accelerate this for an additional 6 months, to put this into the July 1 start as opposed to the delay and having them start in January? What's that number? What did we save by deferring it, I guess is my question.
So by deferring the hiring, we're saving about a little over $1 million for the hiring. So there's two different things happening here, though.
Yeah, go ahead.
Very different numbers, and I can go back and draw this all up and send it to you. There's a hiring date when you hire them into the academy, and you're just paying their salaries. A whole nother cost when you deploy them and make them daily staffed positions.
Oh, okay.
All right. So those are two very different costs. What's that we're talking about?
So walk us through that.
Well, to staff a daily roster position costs between $500,000 and $600,000 a year to staff one, and you can either do that through a PIN, which is someone making a salary and benefits, or you can fill that roster position with overtime.
Okay.
The cost is about the same either way, right? That's the cost of a roster, like a daily filled roster position.
Okay, so then help me, in my mind, get to the end point. So you said it's $1 million to accelerate and to hire them, but then you said the daily cost is this $500,000 a year.
Times 21.
Yeah, is that the case? Is it $500,000 times 21, or is one spot equivalent to 3 or 5?
5.2.
5.2, right.
Yes, sir.
Okay. So what's the real cost then?
I can go back and work that up in the email.
Okay, thank you.
So you can see it.
Yep. Appreciate that. I do. You guys want to jump in? I have
Yeah.
more, but
So on the
sorry.
No, go ahead.
on the class that was already, or the pool of folks that are already in the pipeline, the waiting list of folks that got reviewed last year, I'm assuming that's hundreds or at least dozens of people. Some have gotten, at least 20 have gotten a call to start this class here in July or whenever it's going to start. That class has already done CPAT, right? And background and all the other stuff. So it's not like we would have to do all that if we start calling down that tree and say, hey, there's 21 more availabilities, and we get to 21, and there's no reason why we have to, there's a lag time in recruiting and doing it, because there's a pool already waiting that has already been vetted. Is that a correct
You are
statement?
correct. You're on the right track. We would have to do a update on their background from the time they did their original through this period of time to make sure nothing changed. And then we have to send them for their medical review and to make sure everything is good there. But you are correct. Their CPAT is still valid. They've already taken their entry-level exams. They're already on the list. Normally, the biggest concern is who has already accepted a job somewhere else, that type of thing. But you are correct, and there's just a partial piece to finish.
From now until June, going through that administrative, they're not paid. They volunteer to come and perform whatever activities we need them to perform to qualify for the June or July 1st start class. Or whatever
We
that
just
July-
pay the cost of each medical exam, which we can pull, and then we pay the cost for the background to be completed per applicant. And you will have to do more, obviously, to then get the number that you want. We lose more in background than we do in medical. Our average out of medical is we maybe only lose 1 or 2, depending on the size that we send through. So it's the time of scheduling, getting them in, making sure they're responsive to our request of if they would like to be employed with Anne Arundel County. But it's only that partial piece to finish and then those
Right.
costs to finish that
But
out.
that's not huge. That's not in the millions. That might be.
No, sir. The only other thing I shouldn't say the only, one of the other additional things that has to be added in is then at the training academy where Chief Falscraft is assigned, making sure uniforms, books, those types of things are accounted for, gear, everything that they need, and those costs of the logistics of the items that each individual member needs at the Recruit Academy.
So the real cost is in the ballpark of like 1 million-ish if we were to move them up based off of what you all said earlier.
Did your cost include
Uniforms?
was your cost including the uniforms, correct?
Yeah, that's a one-time.
Right.
Yeah, so it's just that,
Got it.
correct. It is
Okay.
included, yes, sir.
Appreciate it. Thank you.
Ms. Pickard.
Getting confusing, but I wanted to just ask about the hiring process a little bit. I'm not asking you to be critical of any other department, but in county government, but I know we've had issues in the police department in losing cadet candidates because they're waiting for the academy class to start, and we've created some opportunities for them to come on before in a paid way, so we don't lose them to other jurisdictions. How is that working in fire department?
Better than it has in the past. We are definitely moving in the right direction. When you heard 6 months for the time of the hiring process, that's actually reduced from what it was. For years, it was anywhere from 8 to 12 months. The things that we are trying, which we tried in a previous cycle, was the ability to, do online testing, to be able to take that multiple choice test online and to sign up to do that. Anything that works in terms with the recruitment, the retention model of how applicants come in. So we are continuing to reduce and work with our partners in the Office of Personnel. The continuing hiring piece we feel is pretty important. There's also a push-pull of when you get into the area of how remote, like whether or not we want to use a testing center. So say you want to sign up to be a firefighter and then next week you can go take your multiple choice test. You don't have to wait till June. A lot of those things we really start to weigh the benefit of applicants coming from the region. Not that we aren't accepting of anyone, but then in your retention piece, you start to see that somebody that maybe applied from Georgia or Florida or California, eventually after the first 5 years tends to go back to their home. Where they want to start building a family or where they can take our training skills somewhere else. We have some preventive cost measures in place for depending on how early these folks leave. So we really try to work with that process, the continuing hiring and the ability to test at their own speed, I think is the next step for us. And I know Anne and her team, I actually have an email in my inbox now that are looking at that. We tried to be able to make some of those changes for this process, but just knew we wouldn't be able to make it. We didn't have all the answers to be able to talk about the funding streams to really shorten that or to put everybody in a full rotation consistently. So we're getting there, but we're not there yet. We would like to be able to reduce that
3 to 4 months, which would be more in line with, I would say, other professions, if you will.
Because I feel like we've had conversations about decentralizing some of those touch points with recruits and people who are interested based on their score of their test, or folks that you would like to put eyes on or follow through on a background check. I'm just curious if we've made any progress there.
One of our additional struggles, which is a really good struggle, it's tough when you have good problems. We do have so many applicants that right from the get-go, our cost is higher. We're not processing 200, we're processing 1,100 to be able to come out and take that test. And we're very thoughtful about, there used to be cut scores. Well, I don't think you can judge the best firefighter by one multiple choice 100-question test. So whether or not we had cut scores that anybody that had 70 or below did not advance, that was not working for our model. It wasn't bringing in the best human character, the kindest, most empathetic. It was one test. So I changed that when I came in so that we were able to bring in a more diverse panel of character, or a more diverse panel of candidates, which then keeps us at a higher price cost because we're moving more people consistently through the process. So based on what I felt represented our community, we're incurring the cost appropriately. But if we were to change some of that, I think it does change the model that you're talking about, but it doesn't give us the right outcome.
Mr. Volkey.
Okay, thank you. Back to LifePack for a second. So the LifePack 15 is what you're using right now, and we're going to 35. When is LifePack 15 going to cease to be sort of operationally supported or whatever? Because it sounds like this is an operational issue that you have to move. Is that right?
Yes, sir. That it will be phased out.
Okay.
The time frame is about 5 years. You can't buy a LifePack 15 now. Or if we could, it would be basically
refurbished,
or it certainly would be, they wouldn't support it to the end of its warranty time. So we've already gotten to the point where they aren't going to be supporting the software and the maintenance of that.
In 5 years, or we're there now?
Through that time period, yes, but then also, so to buy one, you'd be buying something that you'd have to get rid of prematurely. And again, the technology has become outdated with this new 35. The majority of our surrounding jurisdictions have already gone to the 35.
Okay. I guess the reason I'm asking it, right, and I understand my job is to ask questions and to try to figure out, are there other options? And I'm sure the best scenario is the one that you've presented to us, which is let's immediately do this, but it also has a pretty big price tag. Looks like it's about $2.5 million, right? So that's a significant chunk. So the question that I'm asking is, what is the sort of continued usefulness on this, on the 15s? And it sounds like we've got 5 years. I get your point of it might be a waste of money because we're buying these 15s, but you're not going to be able to get their full run. So if you buy them this year, you're only going to get 3-4 years out of them before we replace them. I hear you loud and clear. I understand it. But we obviously have to weigh that cost versus the $2.5 million outlay of, are we going to do this? What was it that got you guys to the point that you said this was an inflection moment where we needed to make this decision now? Like, why is it this budget, this moment? Did you do that cost benefit analysis where you said, if we run this out another 2 years, we're going to be in a different position financially, and so we don't think we can do it? Like, I'm just trying to understand the behind the scenes.
I will say my answer is the questions I asked about the serviceability and when they break and the support, because they cannot be out of service for a long period of time. And as you know, with the $50,000 price tag, we don't have a bunch sitting on the shelf for replacement. So serviceability.
We have 5 years on that.
On the serviceability of that. Correct.
Okay.
But that's what we're seeing being phased out first, is the inability to service what we currently have or moving forward.
Okay.
Then to me, the price and kind of your return on investment did not make sense to spend $50,000 for something that may not be able to be serviced next year, or that would only get us 3 or 4 more years on the street when we know the life of it is easily 10 to 15 years. So to me, it made sense to do it now and get ahead of it.
Okay. But they're $50,000 a piece. You're replacing 5 a year, so it's $250 a year. So even if we were to keep running this out for another 2 years, it would cost us $500,000 as opposed to an outlay right now of $2.5 million. So that's just kind of what I'm looking at is, time value of money. $1 today is worth more than $1 tomorrow. Like, how are we thinking about this holistically in the department? That's what I'm asking you all is, can you shed any more light onto that decision?
I think there's one piece missing for your equation.
Yeah.
And that's the level of care that this really raises the bar for our community.
Yeah.
So to me, I don't know how you factor that cost, but this is available. We know we're going to transition. I don't see why there was any reason to wait and not provide the best possible service on our medical care to our community.
Yeah, I get it. I don't think, again, that's always the argument of, care is, this unquantifiable figure to it. But I also don't think that your department is providing poor care to our community. Right?
We definitely
I don't
are
think any
not.
of us would suggest that.
Absolutely not.
So let's be clear on that. That's a piece that I think is definitely a differentiator, but it's not the only factor in this. So again, is there more to why doing it now versus a year or two from now? I'm just trying to understand, because this is a tight budget, and we know that. Budget office has told us that. We all are seeing it. So I'm just trying to understand that outlay right here, right now, because it's big, especially when we're dealing with this medical thing that we're dealing with from the hospital. We're having to get another engine. We're talking about more staffing. So I'm just looking for that information if I can.
Another aspect of this, the Life Pack 35 has now been out for 2 years.
Okay.
So we've been working on this for about that time period.
Okay.
And in fact, would have loved to have moved on this almost a year ago, but we knew we had to work through the budget process and look at funding options, LDC, grants, and the other. And so this is where we are now, that 2 years into this, and again, we would love to transition and not have such a huge impact all at once, but because of the huge change in technology, and mainly it's the operability and the inoperability between what we have now and what this would be, that we have to do it all at one time. And that's why it's been a few years, and now we need to get it done.
Yeah, and I guess you hit the nail on the head where I'm going, which is the grant funding piece of it, right? I would love to see a way where we potentially look at this decision and say, how can we try to grant fund this? Can it be through local development council? Can it be through VLT? Can it be through some federal program? What can we do on this? Because this, as you all said, seems exactly like the type of thing that we want to grant fund, this sort of transition. And so that's why I'm trying to understand. We've got this significant capital outlay. It's, I'm assuming, one-time money that we could potentially deploy other places in the budget if we could find a way that you all could get to a grant fund for this to be able to then use that money to do it. That's where I'm looking at it. And that's where I'm kind of looking to you to say, I hear you saying right now, federal government isn't doing it, but there's no reason to think that's not going to happen at some point in the future. We also have local development money that we could look at. Why can't we sort of push this to a grant funding desirability, if you will, like get to that point? Is that something we can do?
We have continued to make those requests and to do that based on grants that are available. I guess for me, there's a piece of understanding how critical this piece of equipment is what is my safety net if we don't get that, as we have not gotten over the last 2 years? What are my guarantees that these clinicians have literally the main tool that they need?
Yeah.
So I don't like to cut it that close. We can certainly look, but I'm very firm that this is the appropriate time for the appropriate request.
But we have 5 years from today until they completely stop servicing, or we have 5 years from 2 years ago, so we're 2 years in and we have 3 left. Which is it?
Yeah, we would have to get greater detail.
Okay, I would appreciate that greater detail. I think that'd be
And
helpful.
please tell me exactly again the detail that you're
I want to
asking
know
for.
exactly when whoever the maker of Life Pack 15 says we will no longer be servicing, supporting, or selling these units, right? I hear you on the refurb stuff, I got it, but there's got to be an end date that Life Pack has put out and said the 15 unit will stop being serviced at a date certain. What is that date? I want to know that. And then I want to understand, all right, are we 3 years into it, 2 years into it, or are we at the beginning of a 5-year window? Because then that impacts for me whether we can look at this and say maybe we can kick this a year to keep trying to get grant funding to come back next budget with grant funding for this while continuing to service the existing units that we have and getting the technical support we have, and our people know how to use them, and our citizens have been served by them for the last approximately 15, 20 years. That's the way I'm trying to look at it. In a tight budget year, that's the way I'm going to have to assess that.
I think that makes perfect sense. The only other thing to consider is the training time and the rollout time that we would have to consider. So
Understood.
to not be pushing that as close as possible.
Understood. Thank you.
So if, for instance, we said, okay, we're going to replace half of them, we're going to do it over stages. However, it's a whole new system that everyone has to be trained on, and you couldn't just train half the staff on it because they may be going to other units and they need to be proficient whichever equipment is on there. So
that's correct.
Your old Life Pack 15 people couldn't just jump into an ambulance with a Life Pack 35.
We would significantly put ourselves in a position to have more medical errors than what we do have, which are very low. So we would have to consider if it was a split purchase to basically shelve the original purchase until the rest of it came, which that's really even hard to say, that we would consider purchasing something to put it on the shelf for that dollar amount until we had the full allotment. For a paramedic that works in Severn at Station 4 for 24 hours and then goes to Deal and works another 24 hours, for them to have two different types of critical machinery. The other thing that we also do based on the advancements of our medical technology is dual sequential, which in life-saving measures, we actually use 2 monitors on 1 patient. If we were to get in a scenario that had 115 and 1 Life Pack 35, not good. So there are medical practices that happen with more than 1 monitor on scene.
How reliable are these Life Packs? I mean, when we talk about the servicing, how many at one time you have out of service?
I would have to get you the service numbers, highly reliable. I mean, there might be a couple of instances where a provider starts to realize maybe the cords are getting old because they've twisted them up or, pushed them in the container, the packaging too many times, and then you switch out the cords. But the information provided is extremely accurate. It's how we base a lot of the medical doses. It's what we transmit when we do a 12 lead to the hospital. So high level, severe and critical medical decisions are being made based on what the monitor produces.
Ms. Fiedler.
Thank you, Madam Chair. This is not a question about the medication refills, just a statement for Madam Secretary and Madam Chair. I think it's worth considering an invitation to our medical partners to come in for a work session.
You can see about that.
Putting it on the record.
And I will go to that too. Again, I will reiterate that I find it concerning that a decision like that was made and thrust upon y'all outside of the budget cycle. So there was not an opportunity for the county to respond to that and build that in. That's a significant change on there. But going back to the mobile integrated community health, I love this program that you go in, and especially from some of our, frequent flyers who call often and use us, and often it is easier fixes at home that can help them, assist them so that they don't need to be calling 911 all the time. Do y'all have numbers for how you've been able to reduce some of the people who do call frequently?
Yes, ma'am, we do. I'll send it to all the council members. There's also a dollar amount that has been very beneficial to our hospital systems based on, they base that on the rate of return of when a patient has to come back in, whether it's within 24 or 48 hours, and what that looks for their data and metrics on how well they're doing with their intake and patients of a certain age range. So we'll be happy to supply that to you. The numbers are very good.
Yes, that would be great. But I think everything else that I was going to ask was covered extensively with Life Pack and medication. And so I think Mr. Volke has another one.
I do.
We're never boring. You guys can never say the fire department's boring.
I always try to come prepared. So, revenues, I want to talk about that. In the revenue estimates for ambulance fees, they look like they're down year over year. Can you speak to that? From what I can see, it looks like maybe about a $3.5 million reduction from FY26 at $27 million to $23.5 in FY27. What are we seeing there? Because I know we have the billing person, and part of the getting the billing person was we thought this was going to help us to recoup as much of these as we could. And we've seen that historically, but this seems like a pretty big drop for 1 year. So what's going on there?
I can send you the information. We did have a jump in 1 year, and we were looking at that as, oh, the numbers are going up, and it really wasn't.
Okay.
It was a one-time flip where we got in funding. So, and
where?
I can get you the information for that year. But really, this is fixing the number where it's more accurate. Instead of showing it up, we wanted to show what we're actually receiving.
Okay.
And we receive the funds. They're not all like year to year. They come in, Medicaid funding comes in a little later. So it's not as though our year to year is actually tied to that year. So it's hard to say as you go through the year when we're going to get that additional funding in and when the insurance companies will send it in. So what we've started to do now is just we're looking at actual fiscal year to fiscal year, and that's what we're using.
I'm laughing because I'm thinking of Mr. Trumbauer talking about right-sizing things. And this sounds like a normalization or a right-sizing of the number. Yes?
Yes.
Okay. All right.
And let me just quickly add the individual you mentioned from previous budget
Yes.
is with our finance department, and Billy Penley, who is working over there. I know there have been some struggles on hiring and retention of that position.
Oh, okay. Gotcha. Well, we'll see them soon, so we'll ask about that. All right. Yeah, if you can get me that information, very helpful. Thank you.
All right. Any further questions for the fire department? All right. Thank you all very much. This was very informative, very enlightening.
Would anybody like to see capital, or are you just totally burnt out?
We were so into that. My apologies.
I can be really fast.
No, we got so into all of that
sorry,
that we
you guys,
totally
I'm
forgot.
sorry.
My colleagues,
Please,
yeah.
capital, please. go for it.
And again, capital, look at the look on Councilman Volke's face. I know. So let's leave the less expensive items and move to the more expensive, because that makes everybody happy. I will be very quick. None of this is information that y'all have not seen before. Here's the list of capital projects. Really, we're going to be talking about closing some projects and what it takes for some scheduling or financial changes. So maintenance projects, repair and renovation for our volunteer-owned fire stations. Also with that is fire suppression tanks. These are the underground tanks that replace when we don't have hydrants where we're able to draft water out of, and then infrastructure repairs. And you'll see the page numbers are listed there for all of you. Crownsville and Galesville, both open, active working station. For those of you that joins me at Crownsville, thank you. It is a beautiful station. Galesville, just kind of the finishing off of that project, which has been in play and been staffed. Fire Training Academy, again, nothing new. You've heard me talk about this every year. You can see the projected project costs there on the bottom. Cape Sinclair Fire Station, again, thank you to those of you that came out for our groundbreaking. That is already happening and in place. This is the one where we're building in the parking lot so we can maintain and stay in the old station, and then we'll tear down the old one and turn that into the parking lot. And that is well underway. Arundel Fire Station, this is just a move up in this project, absolute necessity based on the size of the station and how many people are working there. It is incredibly small. And we need to make sure that we continue putting our employees in the best position in the best facilities. Chapel Fire Station will follow that. Again, same piece of property as we work through this project and keep this in the queue. And then we have Jessup Fire Station, which is almost through its design phase, and we have the property for that. So this will be the next one after Cape Sinclair. This will be our next groundbreaking. And as I tried to keep it short, I'm certainly happy to answer any questions, but just trying to be respectful.
Mr. Volke.
Hi again. Okay, I want to look at Arundel, Chapel, and Jessup and just compare the three. Chapel looks like it's pretty well wrapped up, $25.5 million for that station. Arundel moved up $30 million for that station. Jessup, $35.6 million for that station. What explains the $10 million variance between Chapel, Jessup, and the 5 million variance between Arundel and Jessup.
Chris, or budget from a DPW standpoint, or is DPW here?
I saw he was back there.
Good afternoon. David Braun with the
Yes,
Department
sir.
of Public Works. I don't know that I can have specifics for you today. I can work on those.
Yeah.
But in general, especially at Jessup, there are a lot of environmental issues we have to deal with on the property.
Okay.
I'm not going to say that's the full cost, but that is one major one. And we also have much more recent cost estimates on Jessup than we do on the others because that's an active design. So we've been updating things as we go on that one. But we can get you a breakdown of where the cost differences are.
Okay, and we haven't gotten to it yet in our budget deliberations, but I know there are folks being added to the county payroll that the county executive teed up who are supposed to be looking at capital projects and trying to find a way to decrease the cost of capital projects. So to the extent that we're getting there, I would be very interested to know what we think we're going to save in terms of putting these people into the budget and how that's then going to impact some of these variances that we're seeing. Because Councilman Smith has said this a couple times. I would agree with it. The idea of, we should sort of be doing similar things in similar places. So when you're $10 million different and they're a year or two apart in the capital program, it really raises a question to say, what's going on here?
Yeah.
So just any information you can provide, I think is helpful for me,
Okay.
maybe for others too.
Yeah,
So.
I think that's going to be a lot of initially QA, QC kind of stuff, but we can provide some details on that as we move forward.
Okay, thank you.
Mr. Smith?
Yeah, I've been pretty consistent over the last 2-3 fiscal years when it comes to the capital side of the house. To see the number jump to 35 million still strikes me for a fire station, especially when, Crownsville, I think Harold Harbor, that replacement that was in the ballpark of like $15 to $17 million. Howard County just did one here recently, and it was like $12 million. And so the Clarksville, Montgomery County did one here in the ballpark of $12-13 million, all within the last 2 years. Mechanicsville, St. Mary's County, they actually did, now it's obviously rural land out there, and they had a 29,000 square feet facility. It was like $9 million. And so I just can't imagine, what is going into a $35 million facility where these other real replacements or construction projects that have been done within the last 2 years, and our price is like significantly higher than that. And so I am certainly not a fan of $30 million fire stations. I'd rather us invest that additional resources into human capital if we can get our CIP down more appropriately. But I definitely want to figure out what land I pass that same plot of land. I live right across the street from where the Jessup Fire Station is. And so I can tell you, I'm not trying to do anything that's not going to impact it literally impacts me. And so, and I want a fire station there. I just don't think we need to spend $35 million on a fire station when I know there are at least 7 examples that I can call to within the last 2 years of fire stations being built for $15 million. And so that's the part that really but I've been on this kick for probably 10 years. I've been saying about the capital program. And if we don't change how we do the procurement process, we're going to have less ability to build things in the future if we don't control how this bidding process works and push back on the folks that are saying this is what it's going to cost. Because I was telling folks $30 million. It's now $35 million. And so all within a year time frame, that cost creeped up. And so that's a lot of money for a fire station. So if we can shrink those back down, press copy paste wherever we go, it's the function that I care about the most, not necessarily some Taj Mahal. So as long as that function is being delivered in a safely manner and they have a facility that can take care of those personnel, we should not be spending $35 million on a fire station. That's just my humble opinion. I love firefighters. I'm just saying I don't think we should be spending $35 million on a fire station.
Okay, understood.
Especially when we just built the Severance Center for $16 million, and it's 30,000 square feet. The fire station is 15,000 square feet. Okay. Blows my mind. All right, no problem. Thank you.
Ms. Ledbetter?
Thank you, Madam Chair. I would love to be copied on the email with the breakdowns as well, please. I do have a question about the Arundel Fire Station. Could you describe where that site ultimately landed? I know there were several different places being looked at one point in time. And I'm just curious, I think I had heard that it was at a spot kind of tucked in on 450. I'll wait to, I'll follow up with that question. I'll let you answer the first.
Yes, ma'am. If you know where the existing fire station is, if you go down to the intersection in the light at 450 and make a left there, you're about 5 or 6 plots down on the right hand, or I'm sorry, on the left hand side there. So it's just right around the corner. One of the biggest things was public water and public sewer. That was really a component of the selection, and that area has been good for our response time. So we wanted to stay tightly, like real close, right in that same area.
Depending upon how far, this is the follow-up question, how far back tucked in some of those plots, just you could easily imagine that there could be ingress, egress either onto 424 or 450. And I was just curious if that was planned yet.
I will get you the address and we can talk about that.
Okay.
Yeah.
It's more of a curiosity, just so I have an understanding. I sometimes do get questions and I just,
Sure.
Those are pretty basic questions to be able to answer on my behalf. So I just want to make sure I'm equipped to
Yes,
do so
absolutely,
accurately.
and valid concerns. Anytime we work with land acquisition, DPW, we're not only looking for just the fit and the right size, we're making sure that we're the lowest impact to the neighborhood and the community around, and that always considers the roads and the traffic patterns and things like that, because unfortunately there would be a cost incurred with that if we had to change that.
Right.
So DPW and land acquisition are very thoughtful about it.
Wonderful. Thank you. I'll look forward to it.
Ms. Rodbian.
Thank you. I realize this question wasn't directed at me, but I feel like we really need to just be realistic about the cost of everything right now. I mean, we've seen the gas prices shoot up $1 per gallon, and that feeds into every other thing that we purchase. And comparing the Severance Center and a fire station just doesn't remotely seem like a fair comparison, given the extensive, very specialized, very unique, sometimes must be custom built for a fire station, that we would compare those two things. Also, the Severance Center was opened 3 years ago, so we're not even in the same time frame anymore. So I'll let the experts pan out, but share more detail on that, but I just don't think we can even make that kind of comparison.
Thank you. I'm sorry. And I would just add the customization is always based on health and wellness, not just aesthetics and character. I sit here with all of you and do not want to be paying $35 million for a fire station either, just as I don't want to be paying $2.3 million for apparatus. And it's awful to sit here and ask for things that expensive. The fact that the cost comes out like that is appalling, and it's what we have to do, though, to get those things built. So the differences are, from a Severance Center to a fire station are, the unique ventilation systems for eliminating cancer, right? The technology that puts us on the street faster. So those differences are important, and I think we can articulate all of that. I know you know that and you see that. My brain does what yours. Why? Why is this so expensive? But it is the cost we are paying, and it is worth housing the employees in the proper manner with the tools that they need to extend their lives and reduce their dangers.
Mr. Smith.
I was just going to say, I'm not, this isn't targeted at you or the
Yes,
fire
sir.
at all. Trust
I
me.
know it's not.
It is not targeted. This is,
No.
this is how we, in our procurement process, disadvantages our county government. And I said that there are some of those examples within the last year. It's not like they're 10 years old. Like within the last year, those are examples of fire stations that have been built in the cost. And so I would argue that if you look out the eastern region and you look at different fire stations that have been built for $10 million, they have those same requirements as far as safety and everything else, carcinogens that get in from the vehicle. They have the exact same requirements, standards that they have to meet nationally. It's we, as a county government, in our procurement process and how we do the bidding specifically, that puts us at a disadvantage when it comes to that. That's exactly what happens. And unless we push back on that process and change the way it's implemented, we're going to continue to get bids because they're going to see we got $35 million and they're going to bid to that $35 million. And that is 100% what happens at the local level. It happens the same thing at the federal level. And so I just want us to be able to stretch our $1.2 billion that we have so they can continue to fund all of these activities over the next 6 years. Otherwise, in 10 years, that 1.2 billion is only going to build like 5 or 6 things instead of the 50 or 60 that we're trying to squeeze in there, because we don't sort of flex when it comes to how that procurement process is initiated. But that's all.
All right, are there any further questions for the fire department? Thank you very much. I think we gave you plenty today.
Thank you. We will be in touch. We have a list of all the requested information, so please give us a couple of days, and we will get back to you with all that information. Thank you for the time and the interest.
Thank you. So,
Madam Chair?
Yes.
I just wanted to at least suggest the idea of taking a brief recess, since we still have 3 departments to go and it's already 1 o'clock.
yes, we take a brief one. Let's please keep it brief because our folks have come from outside. We've got detention and sheriff here, and they've all been, they came in from work. So let's, we'll say 15 minutes. Is that enough?
Oh, not, I was thinking maybe 20 or 25 so we could eat.
Okay, what does everybody think? Okay, okay. All right, eat fast. Let's kind of, it's.
What time are you coming back?
1:15. We're gonna eat fast. No, I understand.
I agree. I'm in the same boat. My mom lives with me. So yeah, yep, I totally agree. Agree.
All right, we are back. Sheriff's Office, Sheriff Sesker, welcome. Thank y'all for being so patient with us.
Ready? All right. Good afternoon. I'm Kyle Madden from the Budget Office. You can find the sheriff's budget on page 330 of your budget book, and I'll turn it over to the sheriff.
Okay, thank you. So I promise you, we will put you back on track with your schedule. Madam Chair, thank you. Council members, thank you. And let me just regress a little bit for last year's budget. Thank you again for what you did for us. And we are back. We are back with our hands out one more time. So let's begin. So with the Sheriff's Office, we're that agency, is public safety agency that is your least expensive, lowest overhead, and lowest wants and needs. Let me just start out with that. I'm getting straight to the point here. As you see our pie chart there, one of the things I said when I took over is not just enough to go out and serve warrants. We got to do a deep dive into the number. And you see 14,867 warrants as of August 5th, 2025. But when you do a deep dive into it, which we did, you see a different picture. So starting in the red, you see it says out of county, out of state warrants, which is 52%. So those are the warrants that are outside of our area that we cannot serve. Outside of the county, they're outside of the state. So that is a total of, let me see. $7,731. I need different glasses. I'm sorry. I'm looking right at it. 7731. I appreciate it. And then we have another piece there, 22%. They're the filed warrants. Now, filed means that they are not being serviced for one reason or another. We have a system in place called Mark 43. Mark 43 tells us why we file certain warrants, because they're unserviceable. But this section right here was before we got the Mark 43 system, which was about 5 years ago. So again, these are filed. I wish I could say I had the staff to do the deep dive to see why they were filed, but I don't have that staff. Now we got another piece here in the green, no address. We get warrants sometimes with no address on it. So these are the warrants that are out there just floating around. Hopefully somebody can stop this person on traffic, they give the right name, and then we can execute the warrant service. Detained. This is another one, 11.4%, 1,695 people. These are people who are already incarcerated. They're already in prison or a county detention center somewhere. So we have a detainer for them. So as soon as they are released, we are notified and we will go pick them up. And in the blue, we have the currently working ones. These are the ones that our deputies are currently working, 1,278. So when you look at the big picture, 14,000, really we're down to 1,278. And we can even back it off a little further because what we found out is that a portion of these warrants here are also, they may be deceased. These are the ones, and we figure this out because we do our research. We go to death records and stuff like that, and we'll find their names in there. We work with the state's attorney's office on this. It's not a quick process, but we do work with them to try and get these warrants removed. So when you do that, it's about 599 people who are, thought of as dead, and that reduces it down to about 679 open warrants. Now, one of the things that I am proud of also, the first part of my administration, we worked on reestablishing the sheriff's office, getting personnel up to staffing. We put some checks and procedures in place. And you remember we had over a 20% vacancy rate in the sheriff's office. And I said I would not come back to you and ask for additional people until we filled that vacancy rate. Well, we did fill that vacancy rate. We filled it, we got to 0, and right now we have about 9 vacancies. We got 2 in the academy that are set to graduate in a week or so, and we got 2 laterals who are in background right now. We did have enough people in process to fill the vacancies, but for one reason or another, they didn't successfully complete it. Now we're waiting for the hiring process to open back up for them. So will we fill those vacancies? Yes. I have no doubt about that. The pillars of my agency is to be modern, effective, efficient, and transparent. So us doing a deep dive in these numbers, that helps us to be effective. That helps us to be effective. It's not just enough to look at a number and say, oh, this is what we got. We did the deep dive. That's why now you are beginning to see a slight decrease that I just told you about. 183, it's not a big thing, but it is the start of something. We're now in that second phase of my administration that I've been telling people about. So we do a lot of work, not just the warrants. We average about 700 warrants a month that we receive. We'll do about 5,200 civil papers that we distribute each month. That includes your tack-ups and other civil papers and things like that. So when I said that I was not going to come to you and ask for additional personnel until we fill those vacancies, yes, I'm coming to you now. I'm asking for additional personnel. Because although we have done well and we're keeping up with stuff, this trend that we are on right now is just not, it's not sustainable. It's not sustainable. And we are predicting that our workload is going to get even more because of certain legislation that has just been passed. And I'm sorry, we're on House Bill 492, Senate Bill 544. We try to forecast things that will happen in law enforcement. And with the death of Judge Wilkinson in 2024, I don't know if you remember Washington County, he was killed in his driveway. My staff and I, we predicted that things were going to change. So at that moment, we had the backing of Judge Schaefer, the Chief Judge for Anne Arundel County Circuit Court. She wanted it. I agreed with her. We started staffing deputies in every courtroom. We have a deputy in every courtroom and every hearing room, and that was unheard of. And I think we, last time, Mr. Volke, we talked about that. That was unheard of back then. I know you will. Okay. But we started doing it early, and now it's going to be law with this new bill. And there's some things that we did not predict with this new bill. And the fact is that one court security officer in each courtroom for any criminal, family, or juvenile proceeding. We took care of that. But we didn't predict 2 court security officers in each courtroom with an incarcerated defendant or who may be incarcerated. 1 court security officer for every courtroom on each floor. So with a possible 13% increase in court cases, we're looking at a daily shortage of 5 to 10 deputies. 5 to 10 deputies that we will need. And on to the next one. So we are that agency. As I come to you, I ask for things, but we're also trying to find ways to save money. With the special police officers that we've already received and the civilian constables that we are looking to obtain, we're looking at possibly saving the county close to $1 million a year. I just don't come with my hands out. We come with cost-saving measures as well. This is the way that we are being good stewards of taxpayers' money. Now, I've asked for 5 deputies in the current budget. We did not get it. And let me say, the 5 deputies are now critical because of this House bill. We're going to be 5 to 10 deputies short each day. These 5 deputies are critical. We cannot wait until the next budget to get these deputies. And let me tell you why. Because this bill takes effect July of next year, July 1st of next year. We need time to actually, and we just talked about it with the fire department, possibly the police department, it takes time to go through the background. The academy is now 9 months long. And then even when these deputies come out, there's a number of days that they have to go through field training with an experienced deputy. So these requirements are needed now. And as I've told you before, when we get a deputy, a car needs to come with that deputy. That's why we were able to reduce some of these warrants. And like I say, 200 and some warrants reduced is not a big thing, but that's the start of something. Because just a couple of weeks ago, or last week it might have been, the judges had a retreat. So we were able to reassign deputies from the courthouse and put them out on the road, which we do on a regular basis. If there's ever a slow day at the courthouse, deputies will go to the road. They will either be looking for wanted people or they will be serving civil process. We're looking for 11 constables. 11 constables will cost about a total cost of $1,094,000, just a little bit more. Now, that's the total cost. The reoccurring cost will be $607,000. So what's the big difference? Because the constables will need a vehicle also. They will not be fully equipped police vehicles and stuff like that, but date myself the equivalent of a K car. Because they need to be able to get to these different properties and things to do these tack-ups. You know, I've been working very hard in the sheriff's office to reduce costs, and I've been working hard, and let me say this too, I want to thank Councilwoman Hummer, because the legislation, the lock and leave, that will definitely help us. That is something that will help us, so thank you. But I've also been at the Capitol. I've been trying to put legislation through there as well that will actually help the sheriff's office and at the same time protect the rights of citizens of Anne Arundel County. So this is in your hands now. We are at a point right now where we're beginning to turn the tide. We're beginning to make improvements. We're beginning to get these warrants down. I'm continuously looking for ways to save the county taxpayers' money. I've worked with the county executive. We were making some great strides in the first 2 years. Last year's budget, we got nothing. This year's budget, we did get 3 drones, which is appreciative. But if we want to continue making progress in the sheriff's office, we're going to have to continue to see improvements. And I cannot stress this enough, and then I'll be done. We're not asking for wants. I estimate we're about We're 80-some deputies, we should be at 160, easily. Is that going to happen overnight with this council? Nope. Is it going to happen in my time as the sheriff? Nope. But we got to keep chipping away at it. Thank you.
Thank you. Mr. Volkey.
Hi, thank you. All right, I'm looking specifically at HB 492. On page 2 of the bill, section C. Beginning July 1, 2027, during court proceedings, any entity responsible for providing courthouse security shall use best efforts to have present a minimum of. Then it lists the staffing. And then it says, beginning July 1, this is in subsection D, 2029, during court proceedings, any entity responsible for providing courthouse security shall use best efforts to have present a minimum of, and then it lists them. So if I'm understanding the law correctly from the way I read it, I don't think you're actually mandated to have this minimum level of staffing that you're talking about. I think you're supposed to use best efforts to do it, but I don't think you're absolutely required to do it. Do you read the law differently than I read it?
No, I read it the same way.
Okay, all right. So I just want to make sure that when we're coming in here saying there is a requirement in state law that we meet, that's not actually accurate. The requirement in state law is that you do the very best that you can.
Yes.
And I can tell you, because I spend as much time as anybody in the courthouse, certainly on this council, that every courtroom I'm in has at least one deputy at this point, right? Because you all have done the work
Yes,
that
sir.
you have to do staff that.
Yep.
And I can tell you that when I've been in criminal proceedings, there's usually at least one deputy, but then there's also people from DOC coming in and out. There's people from other jurisdictions who are transporting. So there's usually at least one, but usually more than one person who is there, who is a law enforcement officer of some form or fashion from some jurisdiction or agency. So I guess that's where I'm looking at it going, I just want to make sure we're getting accurate information out here when we're talking about HB 492, SB 544, and what they're requiring, because I don't think that what this says, where it says that you can't comply with it, I agree that you may need to make more efforts to get there, but the state law doesn't set a minimum requirement. It just says you got to do the best you can. Okay. We agree on that?
Yeah, I agree.
Okay, all right, cool. Thank
All
you.
right.
Yep.
So I am that person again.
Yeah.
I am that person. I am committed to the, in this particular situation, the letter of the law. So let me say this. My best effort is to come to you and say, this is what I need to fulfill this law.
Okay.
The letter of this law.
Yep.
Now I ask you, Mr. Volkey,
Yes.
are you willing to accept responsibility for somebody being hurt or injured because this bill was not fulfilled? Because you just said it's up to us to determine if we need to put extra in there. I'm not willing to accept that.
Well,
I
given-
want additional deputies.
Given that I have the highest propensity out of anybody up here of being one of the people injured in that, I'll accept that. So that's because I'm.
You're
in the
gonna
courthouse.
accept it?
I'm in the courthouse very regularly.
Yes.
And I see the excellent work that your staff does on a day-to-day basis. And I see the way that they respond to incidents immediately, very quickly. And so I will say, I feel very comfortable when I'm in the courthouse. And I think your staff does a great job of that. I appreciate it.
And I thank you, but let me say this also. What everyone sees in the courthouse when they come in is not what goes on behind the scenes. They do not see behind the scenes the struggles that occur. They do not see every time that a citizen acts up or acts out in the lobby. So there are things that go on that we deal with on a regular basis. And the second part of your question, you had another part that you.
I don't think I had a question, but,
Okay,
but I'm good.
statement.
I think we're set on that.
Okay.
May I ask another one?
Certainly.
Thank you. On your slide that talks about cost-saving efforts, so
Yes.
I was trying to find in the public safety article, and I think it's in section 3-303, where it talks about what a special police officer is.
Yes.
Can you tell me the definitions that you all use for a special police officer or a civilian constable and how that compares to a sworn deputy? What's the difference there?
Well, a special police officer has limited ability only on the grounds of the courthouse.
I got you.
So they have arrest powers there.
Okay.
They do not take their weapon home. We cannot utilize them to even come here to this building or go anywhere else in the area if something should occur. And they come at a reduced cost because they don't have to be, we train them. We have a training program that's set through the Maryland Police Training and Standards Commission.
Yeah.
But we don't have to train them on doing vehicle extractions,
Right.
traffic stops, and things like that.
And they don't need a vehicle. They would not have a take-home car.
No.
Right.
And let me say this, the constable
Yeah.
will not be a SPO. So the constable is a civilian position, no weapon, and like I said, no police authority. They are simply going to serve civil process. That is, tack it on a door and leave.
Okay.
And they will be properly trained too. We'll put them through a training process as well.
Okay, but when we talk about courthouse security and people who could provide courthouse security, is it fair? My understanding is you could put SPOs in every single courtroom and you could meet your staffing requirements under, making best efforts under HB 492 that we just talked about by doing that with SPOs in every courtroom, right?
I'm not inclined to do that because, and I tell you why, because the training regimen for our deputies are much greater than what we have for the SPOs. Right now, the SPOs, they protect certain doors coming into the courthouse, doors that involve courthouse personnel coming in. If you ever see an SPO on the front door, they will always be with 1 or 2 deputies.
Yep, I've seen it. But I guess the reason I'm asking this is we've had this discussion, you and I, many times, many previous budget cycles, about the sort of best use of your force, right, that you have at your disposal. And one of the concerns that I have is you have these extremely well-trained, well-qualified deputies who, quite candidly, are just sitting in the corner watching proceedings of courtrooms. And for the most part, there's never an issue, right? When there is, I understand why you got to have deputies, and you certainly are going to need to continue to have fully trained sheriff's deputies in the courthouse in some form or fashion. But you don't necessarily need them in every single courtroom because, especially for like lower likelihood of injury or likelihood of attack type cases, I'm thinking family law cases, I'm thinking juvenile cases downstairs. Maybe for criminal cases, you want to have a deputy still in there. But just thinking about that, there is a different way to kind of deploy the people that you have. And then that would also give you the ability to put more sheriff's deputies on the street, all of whom have a take-home car, have the ability to serve warrants, et cetera. So in just kind of looking at it holistically, I'm not quite sure why we're not focusing more on SPOs in the courtrooms, especially where that makes sense, and kind of using them in that way, especially given their limited arrest powers, but their full authority on property that you are entrusted to protect.
Well, let me say this.
Sure.
I base my decisions on my experience as a police officer. And my experience has taught me that you never look at a situation like it'll never occur, least likely. Judge Wilkinson, he presided over a child custody case. And the father in the child custody case followed him home and shot him in his driveway.
Actually, incorrect. He did not follow him home. He went to his house. He found him that evening, and the man had not shown up in court that day. It was a default. It was actually the second iteration of a default. And then Judge Wilkinson was in his home, in his driveway, and that was what happened. So just clarifying that. That was how that went.
I appreciate that. But he shot him in his driveway.
Yes, he did. That's correct.
He shot him in his driveway. I can go back to Prince George's County. 22 years there, we averaged in the DC area just about officer killing every other year. I can tell you about an officer who's sitting in his car, minding his own business, and somebody walked up behind him and shot him in his head. So when you talk to me about the likelihood of something not happening, I don't go with that. I will always err on the side of caution when it comes to people's safety first.
And understood and appreciate that. Thank you for the back and forth. I think when we're allocating dollars and when we're having to figure out where the best use of those dollars is, I think there is a certain degree of we have to assess sort of probabilities, possibilities, and what those scenarios look like. That's part of the job that we have. But I certainly respect your law enforcement background and the positions that you're presenting. So thank you.
Thank you.
All right. Are there any further questions for the sheriff? And do we still have capital to do for you?
Excuse me?
No capital? Okay. I almost missed capital before, so I got to make sure that I'm covering
No
myself
capital.
and that we've gotten everything. So thank y'all so much. Again, I really appreciate y'all hanging out for a while with us as we have today. So, and next up is the Office of Detention. Superintendent Klein, the floor is yours. Superintendent Klein, welcome.
I think we're ready.
Good afternoon. This is Bo Zhao from the Budget Office. The Department of Detention Facilities, their budget is on page 302 of the FY27 proposed budget book. I'm going to turn it over to the superintendent for his presentation.
For the Department of Detention Facilities, and I'm honored to appear before you today to present our FY27 operating and capital budget for the Department of Detention Facilities. I'd first like to begin by introducing my executive staff who are here with me today. To the immediate far right is Correctional Facility Administrator John Kelson, who serves at the Ordnance Road Correctional Center. Next to him is Todd Wasmer. He's the Correctional Facility Administrator for Jennifer Road. Recently started with us in September after Michael Borgese's retirement. Immediately to my right is our Director of Business Services, Kyle Lee. Having just come off a National Correctional Officers and Employees Appreciation Week, I just want to take another opportunity to thank all of my staff for their continued hard work and dedication to the department. I want to give a special mention to our longtime chaplain, Chaplain Fletcher, who will be retiring after 32 years of dedicated and faithful service to our county and the department. I often tell my staff that when it comes to accomplishing our mission, all of my eggs are in their basket. We truly have an amazing team of dedicated professionals. On behalf of all staff at the Department of Detention Facilities, I'd like to thank the county executive, the CAO, the budget office, and the county council for the continued support of our department as we strive to fulfill our mission to provide for public safety through the confinement of pretrial detainees and convicted offenders in safe and secure facilities while monitoring alternatives to incarceration and preparing inmates for community reentry. As we look toward next year, I want to pause and recognize the council members that will not be returning to county council. Thank you for your collaborative relationships that we've built. Your support has been instrumental in the improvements we've implemented. It has been an honor working with all of you. Over the last 5 years, we have significantly lowered staff vacancies, fostered a culture of partnership with our bargaining units, going over 1 year and 2 months without any grievances, fully implemented medication-assisted treatment, received multiple accreditations through the National Commission on Correctional Healthcare, Maryland Correctional and Commission Services, Prison Rape Elimination Act, and the Maryland Police Commission or Correctional Training Commission. We've also received multiple grants, which I hear is a theme today, as well to support and enhance the programs and services for our returning citizens. Guided by the theme of the cost of corrections, our budget submission provides a sustainable roadmap for the department. It is designed to protect our workforce through safe operations and secure facilities, while simultaneously investing in the programs that prepare individuals for productive return to our communities. We are committed to maintaining our recent progress through responsible fiscal stewardship and operational excellence. Before I get into the specifics of our budget request, I want to highlight that the challenges I shared last year still exist today. The MAT funding, the law that requires the state to fully fund MAT, has been in place since 2019, yet the state has continually failed to fully fund our program. This puts an additional burden of $500,000 to $1 million on the county each year. I was hopeful that this year's legislation would correct this deficiency. However, it did not get through committee. We currently provide MAT, medication-assisted treatment, for roughly 150 individuals in our custody every day. To our inmate benefit fund, the new FCC ruling eliminated an estimated $700,000 in site commissions effective last month, April 2026, that go directly into our inmate benefit fund. I want to be clear again that all site commissions we receive go directly back to the programs and services that we provide to our offender population, such as education, law library, library services, and recreational equipment. We have worked very hard these past couple of months to figure out creative ways to limit the impact of this change. Lastly, the Maryland Department of Health continues to break the law in relation to taking patients that have been court-ordered for hospitalization under Section 3-106. This violation significantly impacts our operations. The constitutional violations of these individuals and their inability to receive court-ordered treatment is inhumane. I'm hopeful that the current case in front of the Maryland Supreme Court will be a much-needed push to resolve this longstanding issue. Along with the constitutional violations, the financial burden to the county is significant. For reference, a snapshot this past week shows that we are holding 14 individuals in our facility for a total of 800-plus days past the legal limit at an estimated cost of $240,000. For FY27, I'd just like to take a moment and highlight one specific objective on this list: improving our overall behavioral health system. It's no secret that the jail system has become the de facto mental health facilities nationwide. While I earlier highlighted the challenges that we experience with MDH that add to this issue, we are working every day within our system to make improvements. This is what I call my push-push strategy. While I continue to push the courts and the state to make changes to things that I can't control, I'm also pushing our team to make changes on things that we can control. This has led to mental health court hearings being held at the facility, increased observation rounds, updated assessments, and increased diversion. We're also studying incidents to identify individuals that are in crisis, however, do not show the warning signs. This is similar to a strategy that was employed back in World War II with survivorship bias. They thought that they should be reinforcing the spots on the returning planes that showed the signs of damage, as opposed to reinforcing all of the other areas. They realized that the planes that they were looking at actually survived and that their strategy was wrong. We have realized equally that we have a good process for maintaining the safety of individuals that check all of the warning sign boxes. However, we recognize the current system lacks in identifying the individuals that do not. This next slide here captures some of our major accomplishments. I'll briefly cover a couple of these. As I reported in the past, we continue to be successful in our recruiting efforts. Our vacancies are below 10%. I actually believe currently, as of today, we're sitting at like 7.2% vacancy rate. We've registered 19 apprentices this past year. We finally have the building permit for the reentry hub, and the job will go out to bid within the month. Our Success Through Education program, the STEP program, surpassed 1,100 GEDs for the lifetime of the program. We've successfully returned 5 individuals from DPSCS as part of our local reentry agreement with our program at Ordnance Road, and all of the individuals as part of this program have since been released and have not returned to the department. We've also achieved full compliance with the Maryland Police and Correctional Training Commission on our training. This next slide represents our current general fund FY26 base budget of just a little over $69 million, and the recommended adjustment for FY27, which is the basis for our FY27 general budget of just over $71 million. This is an increase that equates to just roughly a little above 3%. These next 4 slides are the breakdown of our budget by the separate budget unit locations. The first one is Jennifer Road Detention Center, which is our maximum security facility, also is our intake and pretrial facility with the central holding center attached to it. The breakdown there is $38.24 million. Next slide is our Ordnance Road Correctional Center, which is a majority of our sentence population, as well as our weekender and house arrest program, and has a budget of $23.13 million. This will also be the location for the reentry hub. For administration, we have $6.41 million in the budget. And our last is our Central Holding and Processing Center, which has a budget of $5.84 million. This unit continues to process over 6,000 intakes per year in an efficient manner that allows direct access to commissioners and expedites the return of police officers back into the community. I'll go right into our capital here, so we're not forgot. Our FY27 capital budget consists of 4 projects. I know you're looking at the slide saying there are only 3 up there, but 2 of the projects there have funding associated with them. One of the projects that you have, I believe, listed before you is a liquidation of funds, and the other project is fully funded, which is our parking lot. The first project, which has funding associated with it, is for $650,000 for detention center renovations. Again, as I've said before, our facilities continue to age, and the county has done a great job keeping up with that aging process. Jennifer Road is roughly 66 years old, and Ordnance Road, which is the newer of the facilities, is just cresting on about 30 years old itself. They require routine maintenance and repairs. Generally, you would see this request at $250,000. However, this year we have a kitchen floor replacement. That's why the increase is up to $650,000. The other funding will go towards routine maintenance, fencing, painting. We have a delivery gate motor that needs to be repaired for one of our salad ports. Our second project is the Ordnance Road Comprehensive Reentry Hub. This totals $664,000. Again, transforming this underutilized space is into a dedicated reentry hub is more than a logistical move. It's a commitment to long-term community stability. Our last project, which is still in the works, is our central holding and processing parking lot, which I've spoken about my full 5 years here. The parking issue continues to get worse along Jennifer Road. I know Councilwoman Rodvian had reached out this past year. I will say, related to that specific incident, the snow and ice event that we had last year significantly challenged our parking situation. We're a 24/7 operation. We were parked in the spots that we needed to clear. We had nowhere to go. We have any given day 30 plus vehicles parked along Jennifer Road on both sides. The entire sidewalk was covered with snow and ice for days. It's an access issue to the facility. It's a safety issue, as I've spoken about before. The current parking lot plan, I believe, is with the Critical Area Commission, because those are the people that keep emailing me questions. I know there's a meeting set up this week to talk about some mitigation strategies. I will actively participate in that. But it's still a need that we need for our facility to maintain access. In closing, I want to thank you for your time. I know you have a difficult job to do here, figuring out what's worth supporting and what can be moved around. And we recognize the fiscal constraints, obviously, and the gravity of the decisions before you. Regardless of the challenges ahead, our dedicated staff remains unwavering in their mission to ensure public safety and maintain the highest standards of humane, secure care for those in our custody. This budget, if supported, will allow us to continue to improve the safety and morale and effectiveness of our correctional system. We remain committed to working together, providing for public safety, and I'm prepared to answer any questions that you have at this time. Thank you.
Mr. Volkey.
You can go first if you want. I always go first.
Yes, that's right. You should go first.
Okay. Well, I just want to start off and say thank you. I think you all do an excellent job. I continue to be impressed with the way that the facility is run, and I think when there are issues that arise, you and your staff handle them very well. We had a situation where there was a policy that needed to be addressed, and I appreciate the way that your staff handled it and did get to the bottom of it. So I just give kudos to you and your department for that. I don't really have any major questions about your budget, but I do have what I'll refer to as a thought question, right? And I hate asking questions like this publicly because then people are like, this is what you want to do. No, I'm just asking it out loud. If I go to slides 8 and 9 of your presentation and I look at your average daily population between Jennifer Road and Ordnance Road, if I add those two numbers together, they both are at the population capacity for Ordnance, or they are below the capacity for Jennifer Road. Now, I know that Jennifer Road doubles as central holding, and so I don't know if this average daily pop includes the 6,000 or so people that you're holding that looks like it's 3,387 arrestees. So I don't know if that may increase the number of your population or if this includes it. What I'm getting at is, to the extent that we are not using ordinance as we were 6-7 years ago, you know, in the way that we were holding people for Department of Homeland Security, what are we looking at long-term in terms of capacity of these two facilities? Are there any cost savings that can be had by trying to merge some of their operations? What does that look like long-term for you? Just because we're looking at the whole county, everybody on this council understands in a couple years there are going to be big bills that are coming due for certain things. And so just in terms of cost savings that could be had, feel free to tell me why this is a horrible idea. All right, go.
So fair question, good question. Couple things play into that. One, you're looking at numbers of design capacity prior to COVID. So there's a factor, I believe, as you see correctional facilities or, you know, carceral settings, long-term care facilities built in the future post-COVID, you're going to see design and considerations for space, for moving and isolating and being able to contain. I will say our record in our current situation was astonishing during COVID. We had 0 deaths in our facility. We had 1 person go to the hospital. They didn't even go to the hospital for COVID. They only found out that they had COVID once they went to the hospital. So the ability to move and adjust is always critical for our operations. The other thing that you don't see in the numbers is the different styles of the facility. So Ordnance Road, which was built in the late 90s, is built on a direct supervision model. That direct supervision model works with a certain classification of inmate. So Jennifer Road, which is our maximum security, has a very different build. We have some direct supervision, but we mostly have indirect supervision there. So a good correctional system needs all of those components. I will say in my 30 years of correctional experience, having traveled everywhere and seen different systems, Anne Arundel County has a good balance of what is needed. So although there is space, that space allows us to do what we need to do effectively and efficiently. The utilization study, which sort of turned into the creation of the reentry hub, I think is a fair utilization of that space, but that doesn't give up the space either, right? That build and that design also allows us to recapture it back. Because what I don't want to do is put the county in a position to say, we've closed something and 5 years down the road, the landscape significantly changes, and then we need to get something. And the discussions prior about $35 million for a fire department, I can tell you right now, building a new correctional facility, one, nobody wants a correctional facility in their backyard ever, okay? Fire departments are probably much more preferred, but then the cost of what that infrastructure looks like is exorbitant. So I think we have the system and we're utilizing it. It gives us an opportunity to provide safe and humane security overall. We're well suited though when the sheriff's office does a warrant sweep. I'm not sweating figuring out how I put people in unsafe and inhumane conditions.
Much appreciated.
Thank you.
Ms. Rabia.
Thank you. So my question, my first question is about staffing. So you said your vacancy rate is down near 7%, which sounds like fantastic. How does that reflect the actual need of your staffing? I know, there's always what you've got, the number of vacancies that you have available, could you fill them all, and then what you actually need. I'm curious to just hear you talk about that a little bit.
So similarly, I don't know if I made the promise that I wouldn't come and ask for positions when I had vacancies, but that's something I believe in, right? It's hard to go and ask for something when you can't fill what you have. I think right now, I think it meets the need. I think we're going to see some adjustments when we have a lot of our population that have significant medical needs. We're finding a large portion, the majority of our overtime is hospitalization. It's sending people outside to appointments. It's sending people to stay in the hospital where we're having to staff. Our staffing matrix is not built for those because one day you have it, the next day you don't. One time you have it for 3 months in a row. But I do think...
Just to clarify, that means like an officer is responsible for transporting, but then staying with the person when they're getting the medical treatment.
Yep.
Okay, so that obviously changes the needs or increases the needs by one person at the facility.
Yeah, we actually take 2 people out for the hospital detail, and then we're backfilling that with overtime at the facility. Okay. Those aren't general positions that we have built into our staffing matrix. I think, though, the data will show probably here, maybe within the next year or two, that we're going to have to figure out how to staff those and what that staffing looks like, whether it's a full-time position or we create like a shift relief officer type position that can, when there's nobody in the hospital, they can fit into the fold of what we're doing operationally at the facility. We're having those discussions. I think we had a discussion maybe last week in reference to that. But those are the anomalies are really the transportation aspects. And it's hard to strike the balance of, again, it's high one month, it's non-existent the next. And so it's easy to staff it without a full-time position on overtime, but then that's balancing out also the wellness of your staff and how much overtime you have. Our top 3 categories for overtime are hospital transportation and then disability leave use from the officers, and I think FMLA. So I think we're in a good spot right now, but I think we're starting to get to that spot where maybe we need to figure out how to fill those 2 voids in transportation and hospital.
And can I ask a follow-up? And what kind of healthcare or even just sort of first aid is available in the, in the facilities themselves? I'm imagining, because your detention officers have gone through police academy, they've gone through pretty significant
First aid for, sorry.
Yeah, in the facilities. What kind of first aid or medical care is available in the facilities? Like, is there staff that can address, sort of more straightforward, I don't know, like, do you have a school health nurse?
Is this for staff or for the population?
No, sorry, for the population.
Okay, yeah. All of our staff are trained as first responders. Okay. So that's basic CPR, AED, Narcan. We're also trained as mental health first aid as well. So we go through we host our own academy. So there's a lot of direct training that goes directly to our staff, but then we also have full-time medical staff at the facility. So we have a comprehensive medical contract that also has 24-hour nursing. We have med techs that deliver medication. Most of the time, our staff are the first to respond. I will say their success rate on providing CPR and life-saving measures is, bar none, some of the best that we've seen. I've had many a medical professional tell individuals that are incarcerated, had they not been where they were with the people that were trained to deliver the care that they did, they wouldn't have survived. So all staff have that training.
Okay.
Absolutely.
Thank you. I just didn't know that, and that helps have a bigger picture, a fuller picture of what's going on. And then I've just got one last question is, you mentioned the age of the Jennifer Road facility, and I'm just curious, I have visited both now. I hadn't been to the Jennifer Road, but I finally made it to Jennifer Road, and it definitely is a facility that it's showing its age. Do you see on the horizon, a replacement facility? I know location, like you said, is tricky.
It's set in the prime spot, right? We're between a fire station and a hospital. I think that there was a huge investment with attaching the central holding processing center to the side of that and how that integrates with the overall flow of the population throughout the facility. I think, sort of leaning on the previous question, I think if I was forced to make decisions, I think the expansion to me would probably be investing in the space at Ordnance Road and creating some of those more indirect supervision, maximum security housing style units up in that location. Just one, because we have the space, and 2, that's really where what's lacking for that facility as a comprehensive correctional system.
Okay. Thank you. That's all I've got.
Ms. Pickard.
Thank you, Madam Chair. Superintendent Klein and your team, thank you for being here. I know I've spent considerable time at your facilities and with you, and your numbers about grievances is impressive.
Thank you.
Very impressive, because I know if you've had a comprehensive tour of either of our detention centers, you will get the clear understanding of the intersection of bad policy and underfunded other resources around the state and the coming into a perfect storm in your facilities. And it's shocking at some level to see what y'all have to deal with on the daily basis. And so it's, kudos to y'all for keeping your staff, not complaining. But
it's a collaboration.
It's, you really do have a lot of forces at play that come to roost there in our detention centers. And I know like, I wouldn't even know where to start. I know we've had so many conversations, and I think I spent 3 hours, but thinking about all the different policymakers that are pushing down bad policy in the state is, we have a lot of work to do in this arena. Mental health, juvenile detention, it's medically assisted
Treatment. Yeah.
treatment. It's a perfect storm of how we should be doing better.
I appreciate that. I tell people we are a business. One, we're at the back end of the system, right? We're at the back end of the criminal justice system, but then we don't choose who comes to us. We don't choose how long they come to us. And we receive them in some of the worst condition, going through the worst times of their lives. And we do our best to try and manage that. And I do push very hard. I believe I'm not receiving Christmas cards from the Department of Health, at the state level, and I'm okay with that. But there are some larger things that need to be fixed at the state level. The juvenile legislation, I believe, is waiting for the governor to sign, which will eliminate juveniles being held in an adult correctional facility effective 2029. So I've marked that on my calendar. I've already told my staff as of that date, we will not accept them in accordance with the law. And that'll probably be the first time in my career that I'm able to actually turn somebody away. But yeah, I appreciate, I appreciate you coming out and touring. And we do have good partnerships. Our goals, my goals, and the union's goals are the same. We might have different ideas as to how we get there, or what we can do, whether it's fiscally or policy-wise, or what's driven through state level policy. But we've done a good job to come together and try and solve those issues together. So thank you.
Well, thank you. Thank you all very much. I don't have any questions about your budget at this time.
Mr. Volk.
Thanks again. I do want to follow up on your Department of Health piece. So I've talked to some of the judges who are as frustrated about this as you are. I even know some of the judges who have issued show causes to the Department of Health demanding that they come in and explain why they are not taking people who have been found not criminally responsible and moving them into the Department of Health's custody where they should be. I guess my question to you, I know it's state level policy. Is there anything that we can do at a county level to try to push more on that, to help you both from a cost standpoint, but also from the standpoint of folks should be getting the help that they are constitutionally allowed and required to be getting?
There's a lot of activity going on at the state level. Last night, I was on a statewide steering committee for behavioral health. I can't remember the entire acronym of what they created for it. But I think just continue in whatever capacity you can to push that. I think today I received notice that the public defender's office filed for court sanctions in 6 cases of the 14 probably that I just mentioned to you. I think we just can't let off the gas pedal. I think it's gone on too long. I know when I came in, I was astounded to hear that it was as bad as it was. And I made it my personal mission to make sure that it wasn't going to continue, or that people would know that I'm doing everything I can do to prevent it from happening. The cost is definitely a concern. There have been cases ruled in our favor. I think the last time I looked at the total, it was some $300,000+ that is currently owed to the county. I think they're waiting to see what's going on with, I think it's the Bolden case that's up at the Maryland Supreme Court. My initial take was it's not about the money, it's about the attention and the cause. But I also sit here and, know that we're dealing with, fiscal challenges. And it is a cost, right? At $290 a day to have somebody that shouldn't be there. It's the cost is the smallest portion for me, because these are people that can't advocate for themselves, that are in horrible conditions with their, their mental illness, and the state and everybody should be doing more. But anything you can do to further that cause, through local, delegates and representatives, I would say, please, ask me for the information. We're looking to add some of that data to our Arundel Stat dashboard, so it's more public facing, so people can actually see what's going on. But yeah, anything you could do to support that, I appreciate it.
Without going into the substance of any conversation that may or may not have been had, have there ever been discussions with the County Office of Law about them representing detention facilities going after the state for anything like recoupment of these costs, or having this reduced to a judgment where it starts accruing interest? Because obviously we're holding a bag on money we're owed and we're not getting inflation on that. So
without breaking attorney-client privilege, we've had some discussions about strategy. The first, obviously, is that the Public Defender's Office is representing a majority of these individuals, so they stepped up and really took the cause from their side. But I will say that the county exec's office and the Office of Law stepped up in a big way by filing an amicus brief in relation to the Supreme Court as a friend of the court to say, hey, this is significant. So that was a huge undertaking, which I asked for, and they delivered. And they've been supporting strategy and thoughts and ideas. But I think right now we're sort of stuck with, there's so many cases piling up, and this Supreme Court is like the sort of the piece that needs to pull to see what's going to trickle down. But they've been very supportive of me. I feel like sometimes I'm pushing too hard, but they've said continue the fight because it's a worthy cause.
yeah, agree. One question about your budget. So other professional services is increasing, it looks like, by $508,700. Can you just speak to that? That's one of your bigger increases in terms of a raw dollar increase.
Bo, do you have that? Apologize. Give me a second.
Yeah, take your time. $508,700. It looks like the FY original was $517. That was in 26, and the proposed in FY 27 is $1,025,700. So it's a plus up of $508,700. Got you. Okay. And is that funded through grants, or is that out of the general fund?
That's funded through the general fund.
General fund, okay. And the Turnaround Thursday funding is leading, what is that? I know the program, but is that going to expand the program? Is that going to take money?
It maintains it at the level that it's been.
Was it grant funded previously and now we're absorbing it in the general fund?
3 years ago, I believe we had received a federal grant related to that.
Okay.
And then after that grant expired, we then moved it into the general fund. So it's put in the budget year to year.
Okay.
So it hasn't been sort of annualized and kept in the budget.
So I guess what I'm trying to understand is, why is it doubling? What, is there something new that's happening with it, or is this like the full absorption of a year's worth of cost in this that we didn't have last year, that we only programmed like half a year for that?
I'm waiting for the analyst to
I was
catch
going
up.
to, if you
Sorry.
want to get back
Yeah.
to me, this
Okay,
isn't
yeah,
like
we can get back
you guys
to you.
can let me know. It's one of the bigger items that I'm seeing in this fancy
Just real
dashboard.
quick, what was the question again?
Yeah, it's other professional services, and the question is, it's going from $517,000 to $1,025,700. It's a total increase of $508,700. Sounds like it might be for Turnaround Thursday. So is it Turnaround Thursday or Turnaround Tuesday?
We're turnaround Thursday.
Thursday. Okay, yeah. Anyway, so if you can just get back to me, that's fine.
Okay, will do. Thank you.
Thank you.
So I just want to thank y'all again. I'm always so impressed with your focus on the care of the inmates and how well you were trying to look after them as people. So thank you for that. And I don't think there's any further questions today, but.
Thank you very much.
And we have one final sound at the Office of Emergency Management folks who've been sitting way back there waiting for us for a while. What? All right, Ms. Emmerich.
Good afternoon, everybody. My name is Marika Hannum with the Budget Office, and you can find the Office of Emergency Management's budget starting on page 314 in the FY 2027 approved budget book. And now Brady will talk to her presentation.
Good afternoon, everyone. Saving the best for last, so hopefully this will go quickly. Again, my name is Preeti Emmerich, Director, Arundel County Office of Emergency Management, and I have here my two deputies. This is Joe Corona, Deputy Director for the Emergency Management, and here is Shante Previtt, who is a Deputy Director for Emergency Communications. Before I start, I do want to thank everyone for their support in the past 6 years that I have been Director, the county administration, the council, especially with the expansion into 911 operations that will happen in a couple of years. So moving on to our operating budget, we have been impacted by the uncertainty in grant funding, and you can see that in our budget summary. Our FY25 grants, FY25 federal grants have not come in yet. That's due to a lot of the uncertainty at FEMA, the DHS shutdown, and lawsuits that are surrounding the grant funding. So we're still waiting to see what the resolution will be. I'm hoping there will be a resolution. We're about a year overdue on the FY25 grant fundings. And so now the federal government has moved on to the other fiscal years, and hopefully we will see some of that grant funding as well. But again, there is still a lot of uncertainty. And again, here is our positions. One thing that will happen, and this is again in terms of our expansion for 911 operations, is the Deputy Director for Emergency Management will go from an appointed, to a merit position, so that we have that continuity of operations as we expand. Here's our organizational chart. Again, thank you for your support in what we have expanded in emergency management, but also as we continue on to further expansion in the next couple of years. Some of the 2025 events we would like to highlight that talks a little bit about our work. A year ago was the unfortunate situation at the Elms apartment where their air conditioning failed and alternative resolutions were not provided to residents, and the county stepped in to provide those alternatives, and a lot of it was door-to-door checks to make sure that the residents were okay, but also opening up an overnight cooling center. Again, this was done in coordination with a lot of other county agencies and our nonprofits, such as our Community Emergency Response Team. We completed our 2025 Hazard Mitigation Plan update that examines the hazards that impact our county and how we could build our resiliency. And then one thing, I term as social resilience, blue sky days, where we have to maintain our operations and make sure that the county is okay. So one example of that is the federal shutdown impacts and the SNAP benefit delays. We did coordinate and develop food drives to make sure that our county's most vulnerable were taken care of during that time period until it was resolved. But again, social resilience has become an important thing in terms of how communities respond and recover to crises. I haven't even touched upon on this slide some of the other things that we are working on, such as an update of our cyber coordination plan, our completion of a COOP program for the county, and that includes all the agencies in the county, even for county council, to make sure there is continuity of operations. Winter Storm Fern. So as times change, there's always new things, all crises that we have to manage. So with this, when you talk about some of the events that have happened, they've been supported, led, developed by personnel in the Office of Emergency Management that are funded by grant funds. And so a lot of the uncertainty of the federal grant fundings impacts not only our positions, but the projects that we're able to do to make sure that the county is prepared for an emergency. So the delays in receiving fiscal year 25 awards will impact 50% of OEM staffing. And those are positions that are 100% on grants or partially funded by grants. These grants also support maintenance of our Emergency Operations Center, training, development of our staff. And lastly, our allied agencies, police and fire, also utilize these grants, these Homeland Security grants, in order to fund some of the training and the equipment that they purchase. So with this, I appreciate the county's support in absorbing the director's salary in their operating budget moving forward. The director, my position was one that was partially grant funded. So I appreciate the recognition of a funding for a cabinet level position to ensure continuity, especially as we expand, and to continue funding a position that is pivotal in major emergencies. Before I move on to capital projects, are there any questions?
So I know this was a couple of years ago, but I keep hearing compliments from people in the community about special events permitting and all the help your offices gives. And some of those were people who weren't really fans of the initial legislation, but they found it to be so helpful and cooperative in running their events. So I just want to pass that on, that your office is doing a great job with that.
Thank you. Appreciate that.
All right, I don't see any questions. Hit us with the capital.
All right, as I mentioned before, we are building a new consolidated 911 with a new Emergency Operations Center. We are all very excited to consolidate those operations and enhance them. So some of the accomplishments this fiscal year, we have advanced the design and development of them. Again, this is a coordinated effort between police, fire, DPW, OIT, and numerous other agencies to make sure we get this right, because this is very important for the county. Fiscal responsibility, we do understand this is a major undertaking, so a lot of what happens through the design process in our meetings is to make sure we're getting the best building in a very responsible manner. So again, we recognize that this is a big undertaking and we want to make sure to do the right thing. And we've gone through the site approvals and the MDE environmental review of the land site. This is the same site the Fire Training Academy will eventually go on as well. With that, we held our second community meeting because it's important for our neighbors to understand why this is going there and what the enhancement of the operations will be. So that was held in December. Actually, was it held in the fall? It was a follow-up to the December 2024 meeting, but we did have a second public meeting, in 2025. And again, it was mainly to update the community on the environmental study that was done and some of the proposed remedial actions and continuing monitoring. And we'll hold more public meetings as we get further into the development of the land, the construction, et cetera. Again, we want to be transparent and make sure that people understand what a benefit this is to the community. This is our capital budget request. There is an increase. I will tell why in the next slide for FY27 and anticipate FY28. So FY27 increase, so new water main that will be built and is dedicated to the building, which we appreciate. Technology, 911 and emergency management obviously is dependent on specialized technology, and we have to make sure we set aside the funds. So when this building is being built and is completed, we have the technology that it needs for it. And of course, everybody's favorite word, inflation. It's a couple of years before we break ground, so we want to account for what the increase in price would be and not delay the project when it comes time for the construction. Funding and grants, again, being fiscally responsible, we are applying for whatever grant we can get. So last year we did receive $3.5 million federal earmark for the technology equipment. That is in addition to the federal earmark we got for the EOC. So again, we are continuing to seek out other pots of money, understanding what a big project this is. We've been successful in this, and so we will continue to apply for what we can. Obviously, making sure that the building is resilient and what we do with the land is resilient as well in terms of the impacts on the community. And again, being fiscally responsible. These are some of the updated designs. We're all very excited about it. And I want to thank you again for bringing in Shantae's position, because the coordination with police and fire operationally and obviously physically with the design of the building has been so helpful and tremendous to ensure a very smooth process. That is all I have.
Questions? Any questions? Ms. Rodvian.
Thank you. I think this will hopefully be quick. But you've encountered a significant impact from the delay or disappearance of federal grant funds. How do you deal with that in a practical matter? How do you proceed? Because you still have to continue doing all the things that you do.
Yeah, and I appreciate that. And it's not even just in Anne Arundel County, it's statewide, right? In terms of some of the, how do you pay for projects and continue forward? There are some things that have taken a reduction in terms of programs. It's a wait and see. And we're definitely looking at things that we need to move forward with and continue, and how do we continue with what we have? And then just monitoring and putting some things on the back burner until we do get some funding. Marika, I don't know if you want to add anything to that. So,
any other questions? Mr. Volk, you don't want to add? Okay. Mr.
Real
Smith.
quick, on the facility, do we know the size of it, the square footage on that joint operations center? Or anticipated ballpark?
I don't know that off the top of my head, so I could.
Yep.
So it's 2 floors. One is dedicated to the 911 center operations, and one to the emergency operations center and emergency management. No, I mean, this has been in the works for a couple of years.
Yeah.
That number has escaped me, but
And I'm not going after the price or anything like that. This is actually in the ballpark of, because I think this is, well, I'll let you tell me the square footage. I don't want to guesstimate, but.
Actually, Dave, do you remember? Dave must know.
I would ask, though, if you could repeat the question again.
Just what the anticipated ballpark square footage of the facility?
In the 30s, aren't we? I want to say it's in the 30s, but I'll have to check on that.
Nope, appreciate it. Thank you.
Yeah. Might even be bigger.
Yeah, my 45.
Because it's got the 2
Yeah.
floors.
The 2, yeah. Okay,
So,
thank you.
but yeah, I'll get you that number.
Appreciate it.
Okay.
Any other questions or comments? Thank you all so much. We appreciate you.
Thank you.
Yes. Is there any other business any council member would like to bring before the county council at this time? Okay, may I have a motion to
moved.
adjourn? Do I have a second? All in favor? Motion carries. The county council is adjourned until tomorrow, May 13th, 2025 at 2 p.m. for more department presentations here in our chambers. Our first public hearing on the FY27 budget will also be here tomorrow evening beginning at 7 p.m. Thank you very much.